26, 2021 San Diego County Board of Supervisors Group Budget Presentation to order, and the San Diego County Flood Control District In-Home Supportive Services Public Authority, San Diego Sanitation District, San Diego County Fire Protection District, and County Successor Agency. I'll ask the clerk to please call the roll.
Thank you, Chair Fletcher. Before I call the roll, I would like to note for the record that one supervisor is participating via teleconference. If there are any votes, they will be handled by a roll call vote. Additionally, before we begin, any members of the public that wish to provide oral testimony by phone during today's meeting, please review the instructions posted on the Clerk of the Board's webpage. With that, I'll now call the roll, noting for the record that Supervisor Anderson is absent. Supervisor Lawson-Remer?
Aye.
Supervisor Desmond? Supervisor Desmond? I see him on the Zoom. Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, here. We're gathered here today to kickstart our fiscal year 21-22 county budget process. The proposed budget you'll hear about today and the process by which we're going about is really guided by our framework for the future the board adopted in January. We are trying to bring not only a more transparent and engaged process to the budget, but also a budget that is more equitable, inclusive, sustainable, with a real commitment to so many of the priorities that the board has outlined through a series of actions over the preceding 5 months. This gathering today is really our inaugural community budget practice, where select departments today and additionally some tomorrow will walk through the details of their proposed budget and the two-year operational plan. The purpose of this new practice is to help educate our community members, our stakeholders, our residents, one another about how the county is proposing to spend county resource. I believe this is the first time we have dropped to this level of detail with individual entities within our larger groups making presentation. And I think this is a healthy and good process for us to go to. A cornerstone of good government is transparency and public participation. And I appreciate the transparency subcommittee Supervisor Anderson and I are on that are working. And I think as we move forward into the future and future subsequent budgets, there will potentially be some additional changes to how we go about doing it. But the goal is to arrive at a budget that reflects the needs of the community and ensure that we have a thoughtful and rigorous process, especially in light of the significant resources that our county oversees and administers. During this process, we're going to hear from staff representing our 4 different business groups. Today's agenda, we'll hear first from the Public Safety Group, and then we will go into the Health and Human Services Agency. Tomorrow, we'll have the 2 remaining groups, our Land Use and Environment Group and our General Finance and Government Group. These presentations are going to give board members an opportunity to ask questions throughout each presentation. Important to note today, there are no action items for us to vote on. There is nothing for us to do other than to inquire, to get informed, and help it shape our budget process as we move forward. Members of the public will also have the opportunity to weigh in with comments and questions at the end of each group presentation. So essentially what we're going to do is begin in a moment, but hear from various components of the public safety group. As each of those entities does their presentation, there'll be an opportunity for board members to ask questions, comments, suggestions, work through that. When we get through the entirety of the public safety group, all of the entities have presented, then we will go to public comment on the totality of public safety group. And then after public comment, there will be a chance for individual staff or departments, if they wish to respond to things they heard, to respond, along with an additional period of board member comments or deliberations if member of the boards would like to follow up on items that they heard from the public. We are planning to get as far as we can, relatively close to the noon hour. At some point around there, we will take a brief break for lunch, and then we will reconvene. But it's our intention to get through both of these business groups today, and appreciate everyone's work with that. Before we start, I want to turn it over for our first really kind of walk through to our CAO, Helen Robbins-Myers, to give opening remarks on the fiscal year 21-22 and 22-23 proposed operation plan, the budget and the proposed plan. And then Helen will turn it over to Ebony, and then we will carry on with our day. So Helen.
Thank you, Chair Fletcher. As you're, and I'm going to not repeat everything you just said, so I'm going to skip through my notes here quickly. As you're aware, the proposed 21-23 operational plan, which we also know as the budget, was published on May the 6th. It is the largest proposed budget in county history, And it also has the largest number of proposed staff increases in more than 3 decades to carry out the strategic framework that this new board, delivered to us in January of this year. The regular budget hearing process will actually begin on June 14th at 9 a.m., and it includes an evening public hearing on June 16th at 5:30 p.m. As has been our practice for many years, once the hearings are complete, we will have open deliberations, which also includes documents that we refer to as the change letters. Those will be considered before the board adopts the final budget plan. So what do we want to accomplish today? I think the chair has mentioned that clearly. Let me just say it's an effort to increase transparency and facilitate active public engagement. We added these 2 days of preliminary budget hearings to provide more details regarding expected revenue and expenditures within our larger departments. As you're aware, the budget, it's actually a pretty complex, boring document, unless you're a fiscal genius or want to be put to sleep. But a lot of people are very interested in it, and they really don't understand how to get through to a line item that they're particularly interested in. So the budget hearings today will facilitate that ability, we hope. And we will certainly learn from today and improve upon that even next year to make this a more transparent process for the public. So that really is our goal today. All the department heads want to be very transparent and make deciphering of their particular part of the budget easy for our residents. We want them to have more visibility into where their tax dollars are going. So with this early look, you'll have a more thorough understanding of our proposed expenditure plan. And then I think most importantly, that will enable you to inform your own change letters that you may be bringing forward towards the end of June when we get closer to the end of the budget process. So the outline for today is to allow our Chief Financial Officer, Ebony Shelton, to take 3 to 4 minutes to kick us off with a couple slides. She'll summarize the budget allocations and total staff years, and then we'll jump immediately into the departmental presentations. Those presentations, as you mentioned, will be done by group, starting with Public Safety Group, and then later on this afternoon, Health and Human Services. Tomorrow we'll get to Land Use Environment, and we'll close with the Finance and General Government Group. On June 14th, when we actually begin the regular budget hearings, Ebony will provide a more detailed overview of the budget document, and then we'll open that up also to public comments. So there'll be many, many opportunities for the public to engage with us on this document. With that, I want to thank you for the opportunity to give these overviews, and we look forward to any feedback we receive in advance of budget hearings that begin in a couple weeks. Now, with that, let me turn it over to our Chief Financial Officer, Ebony Shelton.
Good morning, everyone. Hi. Chair Fletcher and members of the board, I'm really excited to kick things off this morning here as the leadership team here of the county takes the opportunity to tell our story a different way to your board as well as to the public. If we can give staff a second to pull up the presentation. Thank you. So with this budget and under your board's leadership, we're really setting a new foundation that's built on racial equity, social and environmental justice, and sustainability. We're examining everything that we do with a renewed focus on transparency and inclusion and bringing all voices to the table using community input and strong data analysis to drive results. So with all of this in mind, we'll take a look at a few quick snapshots of the budget, starting with total staffing by group, or the total budget by group, excuse me. The CAO's recommended budget is $7 billion for the coming fiscal year, which is an increase of $480 million or 7%. There are no cuts to services. Instead, investments are being made to promote equity by investing in people. The 3 primary drivers that are influencing this year's budget growth include the restart of the capital program, resources to continue our regional leadership in the COVID-19 response, and to support investments in our workforce. Countywide, staffing levels are increasing by 660 FTEs from the current year when adjusted to exclude the impact of the air pollution control district transition. On a net basis, this equates to a staffing increase of 496 FTEs. Over half of the staffing increase will bolster our essential safety net services, provide treatment and wraparound services to our most vulnerable and at-risk populations, as well as help San Diego's working families navigate through the county to get access to the resources and support that they need. The other half of the staffing increase is concentrated in public safety, including additional nurses, health, and mental health staff to provide services to victims of crimes and to enforce unlicensed cannabis operations, for juvenile diversion, and to improve public defense. Staffing is also being added in public works and land use activities, for legal services, and to promote community outreach and engagement. General purpose revenues, your board's only source of discretionary revenue, is projected to increase by $131.2 million, or 9.2%, to just under $1.6 billion. General purpose revenue is allocated annually to fund county services based on an analysis of available program revenues, federal or state service delivery obligations, and the priorities and strategic directions set by your board. Our general purpose revenues are highly dependent upon the assessed value of real estate, and although local median home prices are seeing intense growth, overall valuations are being impacted by COVID-19's effect on commercial property values. In the coming budget, we're recommending an assessed value growth assumption of 3%, along with decreases in the delinquency rate assumption and growth in former redevelopment revenues. This year's budget makes no formulaic allocations of general purpose revenue to departments, but instead redirects those general purpose revenues to the new priorities of your board, while maintaining our long-term strategy to prepare for labor, pension, and capital costs. County departments have set ambitious goals for the coming year, and we're reporting significant accomplishments to advance our new framework and to improve the community. With this information as an introduction, I'd like to introduce Holly Porter, the General Manager of the Public Safety Group.
Good morning, Chair Fletcher and members of the Board of Supervisors. San Diego County continues to be one of the safest in the nation. As part of a regional coalition of public safety and criminal justice partners, the Public Safety Group supports effective and equitable public safety and criminal justice activities in San Diego County, coordinates with agencies, and receives community input to deliver high-quality programs and services. The 9 departments of the Public Safety Group collectively support the county's strategic initiatives and work to advance the county's vision of a region that is building better health, living safely, and thriving. Today's brief on the Public Safety Group's CAO recommended budget includes a brief overview of Public Safety Group accomplishments, COVID-19 response, and it ends with a look forward. My overview includes highlights from the Office of Emergency Services, the Medical Examiner, Child Support Services, and Department of Animal Services. Following my group overview, we will hear directly from County Fire, Probation, the Public Defender, the District Attorney, and the Sheriff. Over the past year, the Public Safety Group team made significant progress in areas of justice system reform, supporting youth success, and emergency preparedness and response. Continuing justice system reform is key to addressing racial and social equity. Several collaborative courts continued operations, and we celebrated the 10-year anniversary of Veterans Court. Justice and Behavioral Health Partners launched the Felony Mental Health Diversion Program. The District Attorney and Probation Department worked hard to implement AB 1950, reducing the length of probation for thousands of county residents. At the beginning of the fiscal year, the Citizens Law Enforcement Review Board received additional authorities and scope and transitioned to the Finance and General Government Group. Supporting youth success and positive youth outcomes has also been a focus area. The most visible example of this commitment is Phase 1 of the new Youth Transition Campus in Kearny Mesa, which will be complete this fall and incorporates design changes that reflect a rehabilitative approach for youth in custody. Probation has been working with community members, behavioral health, education, and justice partners to implement SB 823, or Juvenile Justice Realignment. On July 1st, Probation will be ready to care for specific youth locally and no longer send them to state detention facilities. In addition, the Sheriff's Department's new 7,000 square foot RESPECT project will serve between 10 and 30 at-risk youth each day in San Marcos, beginning on June 15th. The new campus features an activity area, recording studio, classrooms, a conference room for guest speakers, and an outdoor gym. Wildfire preparedness, emergency readiness, and response were also expanded upon last year as the county continues to invest in disaster readiness. Registration in the Alert San Diego program increased by 8% last year, and the new Text to 911 service launched by the Sheriff's Department in January links emergency services throughout the county and improves safety for county residents. The evolution of county fire and the creation of the Fire Protection District continues our commitment to strengthen fire and emergency response capabilities in the unincorporated area. Even more impressive is the fact that these public safety group accomplishments took place during the COVID-19 pandemic. Numerous public safety group employees were reassigned to support COVID-19 operations, and departments developed standard operating procedures to deliver services by appointment. Public safety group employees also embraced technology and took part in virtual court proceedings, online or by phone probation officer and client check-ins, virtual child support assistance, and socially distanced community outreach programs. For example, the Department of Child Support Services used texting, live chat, and Zoom to communicate with customers in a safe and convenient manner during the pandemic, thereby reducing walk-in customer traffic and miles traveled. Expanded telephone and video teleconferencing access was provided to those in custody to facilitate visits with friends and family. Medical examiner staff saw an increased caseload in 2020, mostly due to a very unfortunate sharp rise in drug-related deaths, in addition to pandemic-related deaths. Medical examiner data is frequently used by public health and behavioral health, in addition to researchers and scientists, to shape and refine their programs. County Fire played a key role in Operation Collaboration by administering COVID-19 vaccine to the most rural parts of our county. Additionally, the Office of Emergency Services implemented a virtual emergency operations center with no reduction in response capability. Each of these COVID-19 response actions were intended to ensure continuity of public services while protecting and supporting the entire public safety group workforce. Despite these many examples of progress and adaptability, we're committed to continuous improvement and welcome a renewed focus on racial and social equity. The Public Safety Group budget increases by $147.1 million, or 7.2% from last fiscal year. This increase is primarily related to negotiated salary and benefit increases and required retirement contributions across departments, and also the net addition of 273 staff years. The change in staffing includes a reduction of 30 vacant and unfunded positions in the Department of Child Support Services. The budget includes increases in activities supported by sales tax-based revenues such as Prop 172 and 2011 public safety realignment. Significant change in the budget are mainly in the Sheriff's Department, Public Defender, and the District Attorney's Office, which will be presented today. The Probation Department and County Fire will also provide more information. The Department of Animal Services includes an increase of $0.4 million to purchase a mobile unit to provide access to animal services in historically underserved communities in the unincorporated area. The budget remains flat for both the departments of the Office of Emergency Services and the Department of Child Support Services. This table highlights the significant budget changes in the public safety group. District Attorney is adding staff to support initiatives such as One Safe Place, the North County Family Justice Center, the Juvenile Diversion Initiative, and Workplace Justice. To enhance medical and mental health throughout the jail system, 141 positions are added in the Sheriff's Department. 45 of those health positions will be assigned to the renovated Rock Mountain Detention Facility. The addition of 191 positions assigned to Rock Mountain will support 3 housing units and additional medical care space. Activating this space will facilitate critical repairs to other detention facilities such as George Bailey and Vista to support jail system compliance with state capacity requirements. The Public Defender is increasing by 28 positions to address increasing case activities, to link clients with behavioral health and housing services, to support the successful Fresh Start program, and to consult on the immigration implications for clients with criminal cases. Medical examiner is adding 3 positions to meet pathologist caseload ratios as required by their accreditation agency and to support an increase in workload. Other significant budget increases include free communication services for inmates and youth in custody, enforcement for unlicensed cannabis operations in the Sheriff's Department, and 2 positions in probation for a public service program funded by the Department of Public Works. This slide shows the components of the $54.3 million increase in the Public Safety Group Executive Office. It's important to note the PSG Executive Office budget of $12.6 million includes $3 million for 14 staff and $9.6 million for facilities and major maintenance costs for all regional court facilities. The contribution for trial courts budget is $67.2 million. This includes the annual fixed payments of $57 million to the state for trial courts, $7.4 million for court facilities, and payments to the court to collect revenue. Both budget units reside in the general fund. The Public Safety Group Executive Office also manages the restricted special revenue funds, including penalty assessment, criminal justice facility construction, courthouse construction, and Proposition 172, which is the largest. Penalty assessment revenues primarily support emergency medical services. Criminal justice facility construction and courthouse construction both support criminal justice facility costs, including debt service payments. Proposition 172 supports regional public safety, criminal justice, and law enforcement services in the Sheriff's Department, the District Attorney, and probation. The revenue source is a dedicated half cent of the statewide sales tax approved by voters in 1993. As you will hear from our department presentations, public safety programs and initiatives will support the framework for our future. Transparency is supported through technology by posting department policies, standard operating procedures, and training requirements to public-facing websites for probation and the Sheriff's Department, and providing open data portals to the public, such as the medical examiner. Public Safety Group contracts for community services will address service gaps, include performance-based outcomes, and expand partnerships with providers and persons with lived experience. To support bold climate action, departments have created new online service models, telework practices, are reducing fleet vehicles, and acquiring hybrid vehicles to demonstrate our commitment to the environment and sustainability. The Public Safety Group has taken significant steps to address racism as a public health crisis, including the establishment of an equity and inclusion work group. A few examples of new specific goals include reaching out to impacted communities to help them access conviction relief through the Public Defender's Fresh Start program, and to connect to emergency notifications through the Office of Emergency Services Alert San Diego program. The Sheriff's Department will establish detailed baseline data to deepen understanding of calls involving mental health needs. And we will continue to partner with the Health and Human Services Agency to provide behavioral health options for those in crisis and connections to care for justice-involved adults, young adults, and youth as part of a comprehensive countywide approach to harm reduction. This includes Public Safety Group's overview, and I will pause there in case there are any questions from the board on the departments that I covered.
Thank you, Holly. Let me ask my colleagues. Obviously, we're going to go through a presentation from County Fire, Probation, Public Defenders, District Attorney, Sheriff in individual things, but if there's any overarching questions about the totality of it, now would be a good time to ask Holly, and then we'll certainly have time at the end as well. I just want to see if any of my colleagues have any questions. No? Okay, let's go to our first one.
Okay, first I'd like to introduce CAL FIRE and County Fire Chief Tony Meacham and Herman Reddick, Director of County Fire.
Good morning, Chair Fletcher and members of the board. Herman Reddick, Director of County Fire, and I will present our fiscal year 21-22 operational plan. San Diego County Fire, formerly known as the San Diego County Fire Authority, delivers comprehensive fire, rescue, and emergency medical services across 1.7 million acres of unincorporated San Diego County. We employ a cooperative approach to providing services through a partnership with the county and CAL FIRE to operate as one department. We operate as a one team with one mission. Our mission is to coordinate, regionalize, and improve fire protection and emergency medical services across the region. In fiscal year 2021, a few of our accomplishments include: on July 7th, the Board of Supervisors accepted the LAFCO recommendation and approved the necessary actions to form the San Diego County Fire Protection District. On December 7th, 2020, LAFCO finalized the reorganization of CSA 135 to the San Diego County Fire Protection District. We implemented Streamline, an inspection tracking system to support community risk reduction activities related to community fire prevention. In collaboration with HHSA, county libraries, other public and private partners, we completed the installation of residential lockboxes on the front door of nearly 200 at-risk individuals to allow first responders access to homes during an emergency, exceeding the goal of 50 due to the implementation of a community-based public outreach program. We supported HHSA with testing for COVID-19 and vaccinations to our lowest health equity areas of the region. County Fire has standards for total response time to ensure incident response based on the population density for an area. For calendar year 2020, we responded to 80% of emergency incidents within 14 minutes and 2 seconds. The total response time standard was met on 77% of emergency incidents. As we look to next fiscal year, we will enhance responsiveness to the changing environment and community needs by providing COVID-19 and flu vaccinations to rural areas of the region through close collaboration with HHSA. To improve the delivery of pre-hospital medical services by ensuring a fire rescue helicopter paramedic is available to provide advanced life support emergency medical services on air rescues throughout the county. We will engage with communities on evacuation planning, defensible space inspections, and enhanced fuel breaks around communities. And we will respond to the growing need for fire protection and emergency medical services in the unincorporated areas of the county by beginning the pre-construction design phase of the East Otay Mesa Fire Station through the evaluation of design proposals, provide firefighter quarters, training, storage, and community education functions. Effective July 1st, 2021, the Emergency Medical Services Agency will transition to San Diego County Fire to enhance the alignment of the integrated functions of fire and EMS. This transition will facilitate coordination with fire, EMS, law enforcement, ambulance companies, and healthcare systems to address and prepare for emergencies, disasters, and other community priorities. This transfer will be reflected in subsequent updates to the operational plan. Finally, we will continue the implementation of our department's strategic plan. Next year, we will perform fire inspections at 90% of our existing businesses in order to reduce the potential for loss and continue to perform 100% of inspections in all state-mandated occupancies. I will now turn the presentation over to Herman.
Thank you, Chief. For fiscal year 21-22, County Fire is relatively flat with a total of 27 full-time staff and a budget of $49.1 million. The net decrease of $0.9 million is due to one-time appropriations for a Type 1 fire engine and various fire equipment to outfit our urban search and rescue vehicle. This chart shows the budget for the county service area, also relatively flat, with a budget of $3.2 million, a net decrease of $300,000. The decrease is also due to one-time appropriations for equipment such as AED defibrillators, cardiac monitors, and narcotic storage vaults. One significant budget adjustment in County Fire's general fund budget was due to the completion of one-time appropriations for fire apparatus and equipment. Most significant budget adjustment is the increase in general purpose revenue allocations, thereby reducing our reliance on one-time funds. This will enable County Fire to continue to provide the current level of fire and emergency medical services to the region. This coming fiscal year, we will improve public access through improvements to our county website and greater access through the County Fire Advisory Board. And we will address climate change impacts through a continued focus on reducing the severity of wildfires by working with Caltrans, on roadside vegetation management, county parks on fuel break maintenance, and public works on county roadside clearances for vegetation management. Now I'll turn it back to Chief Meacham.
Thank you, Herman. As part of our efforts to address racism, we will establish a robust volunteer reserve firefighter outreach component that strengthens the diversity of the program and ensures we reflect the many communities and groups we serve through focused outreach efforts on underrepresented groups and underserved areas. To improve health equity, we will evaluate a community paramedicine program to improve healthcare services for those living in the lowest health equity areas of the district. Finally, we will focus on evacuation readiness among residents through the development of community wildfire protection plans in partnership with Fire Safe Council. These efforts will include education, increased inspections, and working with partnering agencies to clear roadside vegetation.
Chair Fletcher, that concludes Fire's presentation.
Thank you, thank you, Chief. And I want to say a special thank you for everything you all did in COVID, both in continuing to do the job you have to do every day, but also the incredible work of stepping up to help with the vaccination efforts and everything else. I'm very mindful of the dangers of wildfires, and in particular in recent years what we've seen throughout Northern California and other areas of the state, and the reality that certainly could be us. And what seems to be at times a trend of kind of starting in the north, working its way down, resources being driven, and by the time it gets to us, there's not a lot of folks necessarily left to come help because they're fighting other fires. If you get in that catastrophic kind of wind-driven statewide events, the likes of which we have seen in the past. And so just a couple quick questions for you. One is around staffing. I'm curious for our stations, how many of them are 4-person staffed? How many are 3-person staffed? How many are 2-person staffed? If you know off the top of your head, if not, we can follow up with that.
Yeah. Thank you, Chairman Flesher. So as I said, we operate a combined fire department. So all of the CAL FIRE's 18 fire stations and 27 fire engines are staffed with 3 people. Of the 17 county fire stations that we operate, 1 is staffed with 4 people, 13 are staffed at the industry standard 3 people, and we have 3 stations with staffing of 2 people on duty daily.
And and I'm just curious on this, Chief, when you say the industry standard, like this has been a roaring topic for a while. Is 4-person staffing the standard, or is 3-person staffing the standard? And then what are the different standards?
So the National Fire Protection Association, which are not mandated regulations, they're considered best practices, recommends 4 people per fire engine. That is related to OSHA's requirement that for us to enter a burning building, for 2 people to enter, we have to have 2 people immediately available to rescue those entering that environment. While some fire departments funded that 4-person staffing, in California, just due to the fiscal realities, I think the industry standard has been set at a 3-person company, and that's the difference between the two, the recommendations from the national level and the reality of what most fire departments provide at 3-person staffing.
And that's pretty standard throughout the CAL FIRE area, 3-person?
Yeah, all 384 of our engine companies, we staff at 3 people.
3 people, and that's standard throughout the state. That's not just us.
Correct.
Okay. 2-person would seem low.
2-person is low. I do need to recognize that in the last 7 years, we've made incredible progress from really having an all-volunteer fire department. So the stations that we still have 2 people are our slowest and remote stations, Mount Laguna, Shelter Valley, and Ranchita. All of those fire stations continue to provide paramedic service, and we're still effective in those communities. Certainly, we would like to get to 3 people at those, but I need to acknowledge the incredible work through the CAO to just get 2 people to those communities.
Understood.
To provide that level of service.
Well, and I understand, and I greatly appreciate this board has, over the years, made a significant investment in transforming this from where we go, and I think as we continue to move forward, you know, I would certainly like to see us hit the minimum of 3, and ideally 4. I mean, you know, it's a slow station until it's not. And then when it's not, and you've got a situation of 2 in and 2 out, if you got 2, they're not going to go in because there's no one to get. And if it's 3, it's questionable if 2 are going to go in because you don't have 2, you know, that same type of thing. And so I think, you know, tremendous work being done, tremendous state resources being dedicated to issues of wildfire in general, and I think perhaps more we can do. But it's a little concerning, even if it is just 3 stations with 2 people. That would seem to be a little low, and maybe something we can consider as we move forward. Let me go to Vice Chair Vargas.
Thank you, Chair Fletcher, and I also wanted to say thank you for all the work that CAL FIRE has done, specifically in trying to reach out to our communities that have less access. There's two programs that I wanted to just ask you about, Chief. I know that we've had conversations about this. I'm excited to see that the paramedicine program is one that is a priority, and wanted to see if you can explain to me a little bit more about sort of where the targets are going to be around that. And then also, you and I had chatted about the fire science work experience program, particularly with Southwestern College and some other community colleges, and wanted to see if that was also included in the budget, because workforce development is extremely important, and I have seen firsthand the great work, that all of you have done, and how important it is for our youth to be encouraged to participate and be able to get these really amazing jobs. So,
Yeah, thank you, Sarah. Let me start with the first question in terms of our community outreach. We were very fortunate this year to be able to internally redirect funding to convert 2 CAL FIRE 6-month positions. The county was able to provide the other 6-month of funding to increase our community outreach. And one of the things that I'm certainly aware of is as the fire service has become so competitive to get into, that we can only hire those candidates at the top of that list. And where I think we can do a much better job is getting out into the community and having an outreach to point out to our youth that the fire service is an incredible career, and you can have a very good living by working there. So what our intent is we have established partnerships with all 3 of the community colleges in this county that do fire service training, and our intent is to partner with those community colleges, their financial staff, their counselors, educational advisors, and get out into the neighborhoods and really talk to the youth about pathways. And while there's financial aid available for tuition, the cost of a fire academy can be prohibitive for folks. So we're working with our nonprofit partners, our San Diego Regional Fire Foundation, on a grant program to help our most neediest students to be able to attend the fire academy. Southwest College was our most recent partner that we've brought on board. And we're looking at a partnership also through the Urban Corps and the California Conservation Corps to get people that are in those programs into the fire service. So I think we're on the right track with increasing our outreach efforts to get more people to recognize that this is a career for them.
I really appreciate it, and I think the point about how even when there's financial aid, it's really tough. I know that we had to get additional resources for uniforms and things of that nature, and so I think if we can, as we're thinking about from an equity perspective on budgets, that we're thinking about not just providing the service, but how do we ensure that we're being able to get that? And I mean, I for sure would like to look into how we support that, because I think sometimes that creates a barrier for our students to even be able to think about being in these programs. So thank you for that.
And to answer the second part of your question on community paramedicine, I honestly cannot tell you today where that program is going to end up. This is in its infancy. I think the board has given us direction to study this. We have a lot of work to do working with the Public Health Department and HHSA and really looking at what is the niche, because one of the things I'm cognizant of, we don't want to duplicate existing efforts. And so I think we need to see certainly a hospice patient in the rural backcountry at 3 in the morning, there's probably a place for us. Others might be more program design, policy level decisions. The program is going to look different in a very urban, high volume call area than it is where we're lacking healthcare access in the far east parts of the county. So in fair, I think we need to go through the study. We need to really sit down with our partnering agencies and make sure that we're going into this with eyes wide open. But I do believe there's a niche for our paramedics to further engage with the healthcare needs of the community.
Thank you, Vice Chair Vargas. Let's go to Supervisor Desmond.
Thank you, Mr. Chair, and I appreciate your comments on increased staffing, especially in that incorporated area. We've had a pretty dry winter, and I'd like to, which unfortunately means more potential for wildfires in our unincorporated areas, and then spreading into the incorporated areas. But with programs like community programs like the paramedicine, the Operation Collaboration, utilizing utilizing the resources that we have through CAL FIRE, is very important. And I would like to support your recommendation potentially of a larger staffing, at least 3 people per fire engine, if that's possible. But as I lose my voice here, I'm going to going to advocate for the increased staffing. Thank you.
Thank you, Supervisor Desmond. Supervisor Wasson-Reamer.
Yeah, well, first, I definitely want to thank you all for the just really tremendous work that you've done serving our community with COVID. And you look around the state, you look around the country, honestly, we've done so well with our vaccinations, and I think in large part because of the leadership you guys have brought in that effort. And it was certainly a lot of fun to train as a vaccinator with your really, really talented firefighters. So I really appreciate the work that you're doing. I just wanted to circle back to build on Vice Chair Vargas's question around the paramedicine program. Wondering if what your plan is, or if there's a plan around tracking cost savings on the back end for individuals who are being diverted from our hospital systems, so that we can sort of better understand where we're getting, really the best outcomes for our investments in public health and community health.
Thank you, Supervisor. That is certainly going to be one component of the community paramedicine program. Not only the cost to transport somebody alternatively from maybe an ambulance, but also what are the cost savings by not having somebody attend the emergency room. And I think when we look across at certain patient demographics, we can see a regular pattern of when people enter the 911 system. And I think if we can intervene at some point prior to those patients entering the 911 system and point them to a different direction, there's certainly going to be a cost savings. How we get to those metrics and track that, I'm not sure today, but I can tell you that is certainly, I think, in the leader's intent of what we need to do with the program. And that's also going to, once again, involve a very close relationship with HHSA, and then we work through metrics that they're already tracking. And again, where can we assist and partner this? Because I do believe we need to be looking at the entirety of our healthcare system and what is going on currently today in our emergency rooms.
Thank you. So thank you, Chief, for that presentation. And before we move on to the next one, again, our appreciation for everything you're doing, and really a recognition and understanding that I think there's considerable more work as a region we need to do. This is not just CAL FIRE, County Fire. This is really assessing what are the regional risks, what are the regional opportunities. I have some interest in what we could do to build out that regional capacity. I do think that there's been some fair points that have been made around the state efforts and plan are very focused in more the wildlife areas in terms of management and type things, and there could be some more need for that urban wildlife interface with some actual structure hardening and things we can do, understanding the changing nature of wildfires with wind events and conditions, along with what we may be able to do to be better regional partners. What regional assets could potentially be available to all jurisdictions and be shared, and how we might have the ability to flex. And so I think as we move forward, I think in the immediacy of what we're doing, I'm very supportive of it. It concerns me greatly. We have two-person staffing. I think we can have a longer-term debate about the CAL FIRE standard of 3 versus a national standard of 4, but in the immediacy, I think it would be good for this board to explore. Can we make sure we at least get all of your stations to 3 as we plan that process moving forward? And then finally, I just want to point out, although it's not in this section of the budget, the Ryan J. Mitchell First Responder Behavioral Health Program is included and will continue. And just wanted to share anecdotally, I was with a handful of firefighters in a different jurisdiction who had been in a fire. There had been a fatality, civilian, and while I was visiting with them, they got the text from that program that said, hey, we know your folks went through a difficult fire. We know there was some civilian loss of life. If you need help, here's the resources, here's what's going, and I think that program is good. And I would also just like to share that Ryan Mitchell, who the program was named after, just had his workers' comp claim approved, and he now will be listed on the firefighter memorial in Sacramento and in Colorado as a firefighter lost in the line of duty. And so we're reminded of the sacrifice you all make, and we're appreciative of that. So thank you, Chief. Holly, you want to take us to our next presentation?
Thank you. For our next presentation, I'd like to introduce Interim Chief Probation Officer Cesar Escuro.
Good morning, Chair Fletcher and Board. The Probation Department supports community safety by working with county departments, justice agencies, and community partners to supervise and rehabilitate youth and adults. We carry out our mission through team members and client-centered partnerships. We will stand in our values and become innovative through evidence-based practices in the continuum of care, supervision, accountability, and a restorative practice philosophy within a culture of caring and promoting public safety. Our department highlights. We continue to build a trauma-informed culture by training staff on the principles of trauma-informed care, adolescent brain development, mental health, cultural responsiveness, and restorative practices, just to name a few. We have continued to carry out our balanced approach model, which reduces recidivism by providing clients access to rehabilitative services while maintaining public safety. We implemented mental health and treatment teams to increase adult client access to behavioral health services and care coordination. We expanded interim housing services for adults re-entering the community. To prevent youth from re-entering the juvenile justice system or progressing deeper into delinquency or crime, we have continued to use evidence-based prevention and intervention strategies. We ensure that our programs and services align with national best practices, and we make sure that their youth have access to a broad spectrum of services and supports in the community. We revised our booking criteria to divert lower-risk youth to supervision in the community. Looking forward, we are continuing to work on implementing juvenile justice realignment. This has been an ongoing process, and the legislature is working on updates that will provide us with additional information and instructions regarding this new mandate. In the fall, we will see the completion of the first phase of the Youth Transition Campus. This new facility is designed to promote positive youth development. A few miles away, in North Park, our newly rebuilt Ohio Street Probation Office will increase adult and transitional age youth client access to rehabilitative services closer to where they work and where they live. Recently, we realigned a probation officer dedicated to supervising transitional age youth and addressing the specific needs that are unique to this age group. We are pleased to be working with YouthWill, a community-based organization that, like us, seeks to improve youth development and outcomes. We have collaborated with our justice partners to implement Assembly Bill 1950 on probation length of terms to ensure that positive outcomes remain achievable even with shortened probation terms. We will continue our work in incentivizing community supervision practices. Evidence-based practices include supporting positive behavior. For clients meeting their goals, we can recommend early termination of probation where appropriate and where public safety is not put at risk. To build on our efforts to link critical reentry services to our adult population, we will be adding navigators with existing resources in the near future to help clients connect with services such as education, housing, and employment. Where possible, these navigators will include people with lived experiences to guide clients through the reintegration process. In the area of equity and inclusion, our department has developed and put into practice an equity and inclusion strategic plan. This plan serves as a guide and demonstration of our continued commitment to fostering an inclusive environment for both our employees and the communities we serve. As part of our plan, we organize an equity and inclusion committee consisting of a diverse group of staff to identify areas for potential improvement, modifications to policy and procedures, and ways to promote and support cultural awareness and competency. We have also been conducting equity and inclusion listening sessions to provide staff with an open forum for discussions. Our key performance measures. We developed our performance measures to monitor our supervision, rehabilitation, and recidivism reduction efforts. As you can see in the table, we have exceeded our goals in each area. Many of the goals for next year are higher than the goals we adopted for the current fiscal year. We were successful in our adult supervision by supervising clients according to their assessed risk level and focusing service on our higher risk clients. For youth supervision, we ensure that youth have access to a broad spectrum of services and support in the community, including our Alternatives to Detention program. This is one of our community-based programs that help youth at risk of detention connect with resources and services that will help them succeed in the community. The pandemic created challenges that we had to overcome. For example, although in-person visitation was put on hold, we were able to use technology to provide virtual visitation for youth and their families. Our recommended budget for fiscal year 21-22 is just a little over $236 million, which is a $3.4 million increase over our current fiscal year. This includes assigned general fund balance for initiatives and utilizing Proposition 172 funds for ongoing and one-time operational needs. The implementation of Senate Bill 823, Juvenile Justice Realignment, is a new initiative that is not currently included in this year's budget. However, we are working collaboratively with stakeholders to develop and finalize a plan for implementation and evaluate future needs. We have two other minimal funding sources that were separated from the general fund for compliance purposes. The asset forfeiture and inmate welfare funds are utilized for equipment, youth programs, and commissary activities. We are currently monitoring workload and allocating positions to meet current needs and board initiatives. The budget includes the addition of 2 staff for the Public Service Work Program, managed and funded by the Department of Public Works. Framework for our future. Our department implemented several operational changes as a result of the pandemic, and we intend to keep many of them in place even after the pandemic eases. These efforts include the reduction in the use of our facilities, fleet vehicles, increasing the use of hybrid vehicles, and continuing our teleworking practices. To facilitate greater transparency, our department implemented state legislation which requires law enforcement agencies to post standards, policies, procedures, and training on their public-facing websites. In the area of harm reduction, we are implementing reentry officers into each of the regions to support clients for successful reintegration into the community. We are connecting adults to services using housing and employment navigators, community mentors, and supports of those with lived experience. We are enhancing behavioral health and mental health services and linking clients to appropriate treatment services. Racism as a public health crisis. We are creating performance measures to assist our department with equity and inclusion outcomes. For our clients, we seek to provide them with equitable access to services. We opened our 3rd Achievement Center in La Mesa this past February to support our youth. We are co-located at the Lemon Grove Family Resource Center to provide services to our clients in that region. We continue to work with our community-based organizations to serve our clients in the communities in which they live. In conclusion, Probation is committed to moving forward with juvenile justice realignment and redefining adult services. Thank you.
Thank you. Thank you for the presentation on probation. Let me go to my colleagues and see if we have any questions for probation. I believe Vice Chair Vargas.
Thank you so much for all the great work. There you go. Quick question around the navigators in the program, which is kind of like a promotora program, right, that you're going to be using as you're going out there in the communities. Is that directly, are they going to be working really closely with the sworn officers to ensure that sort of it's a partnership? And will that help reduce the caseload as well for probation officers as well? That's one of the comments that I continue to hear when I speak to a lot of the folks in the department, the amount of casework that they have. And so are there any of these interventions and initiatives going to help, with that particular issue?
I think first question, yes, they will work very closely with the probation officers in almost similar to a multidisciplinary team.
Okay.
They'll work together so that they can refer them to either housing, employment, or education. What that will necessarily do is that it will help our officers in managing the caseload because now we have a navigator to help them with education or employment or housing.
Okay. And I'm assuming that these navigators will be, have the cultural competency and know-how of the communities that they're going to be working with and representing, right?
Yes.
Okay. And then in the proposed budget, how much money has been appropriated for the transitional age youth programs?
I'm not aware of any appropriations yet. What we're doing is we're using our resources that we have currently
Okay,
to create right now, it's a unit, one officer, but we are expanding that to another unit in the North County.
okay. And then is there any plans on duplicating the probation community office in North Park elsewhere in San Diego County?
We would love that. We just have to find extra space. That North Park location was a former probation office's for many, many years, and we just updated it.
Okay. And then two more questions, and then I'm done. The plans for adding any programming and resources for adult probationers as well? Do you have any in the budget that are specific to that?
I think currently we're using existing resources for that. I know we want to focus in on the transitional age youth population, and I think we have the resources currently to create those programs.
Okay. And then last but not least, there is an item in the changes for current services. There's a decrease of 0.8 million due to the elimination of the public service work program in the probation department. It's going to go through the Department of Public Works, right? And so is that the program where they're out in the community helping and cleaning and all that? Is that the program?
That's exactly it.
Okay, and so but it's still a partnership, it's just going into a different department?
Exactly.
Okay. All right, thank you very much.
Thank you.
Thank you, Vice Chair Vargas. Supervisor Lawson-Remer.
Thanks. Just a quick question. It looks like the inmate welfare fund is going down. Is that right?
Yes.
And what is that because of a decrease in population, or are there services being cut?
I think for this particular fund, it was based upon the monies that we received from the telephone calls. And so the telephone calls that were paid, we no longer have that fund.
Right, but, in the action we took, we did direct that none of those inmate welfare services should be cut as a result of cuts in those revenues, and
Right.
asked the departments to look internally for other resources to compensate, to ensure that those inmate welfare funds are not, programs are not declining. So I understand that on the revenue side was a change from previous years, but I'm asking on the expenditure side, what services are being cut with the decrease in the inmate welfare fund expenditures? Is it,
Supervisor Lawson-Remer, I don't have that information with me right now, but we'll make sure that we have that information to you by the end of the week.
Okay.
Hi. There are no services that are being cut as an impact. We actually provided an additional general purpose revenue allocation to both probation as well as the sheriff to make up for that revenue loss.
Okay, so it's just more like an accounting issue in terms of where the funds are being accounted. It's not an expenditure issue.
That's correct.
Okay, perfect. Thank you.
Thank you. I've got a quick question around ratios and caseloads, and I think just some clarity. I know the op plan includes a staffing increase, modest staffing increase for probation, but I was wondering if you could just give me some insight into the goal of caseload ratios for juvenile and adult, and then where we actually are today, and then either incorporating into that answer, or we can do it as a follow-up. What percentage of officers are case carrying? Which percentage of your staff are carrying cases?
Got it. Let me answer the first question first, Chair Fletcher. With respect to caseload ratios, there isn't like we would suggest, an industry standard for caseload ratios. What we do know is that the lower caseload, you get better outcomes. So I can't really say right now 40-1 is ideal, because it may be ideal in New York, but may not be ideal here in San Diego. But what we do know is lower caseloads are better. Currently in our department, our caseloads are probably at 50-1 for the adult side. On the youth side, they're at 25-1, but I think they're a little bit lower than that. And that is just because I think in the midst of the pandemic, we had a lot of cases not going through the court process, and thus cases or clients coming to probation.
But do we have an internal probation guide? What is our goal in terms of caseloads, or do we not?
We do. It's 50-1.
50-1 for adult?
50-1 for adult, and specialty caseloads, Chair Fletcher, 40-1 and 25-1.
Got it. So 40-1 in the specialty cases? And what are those?
That would be PRCS, post-release community supervision. Our formal probation is 50-1. And then we have mandatory supervision, that's 25-1.
Got it. And then juvenile, 25-1.
25-1.
And we're at those ratios now?
We're currently at those ratios currently.
Okay. What percent in adult and juvenile of probation officers are carrying cases?
That we will have to get back to you.
Okay. Yeah, if you could send that to me, I'd be
Sure.
interested in that. Great, thank you. Let me ask my colleagues, any other questions for probation? Yeah, we'll share the data with everyone. Yeah. No, we will get that. We'll send that to all the board offices. Yes, that would be helpful.
Just if I can
Please,
jump
of
in
course.
here, we did send that out last week. I'll make sure it gets directly to you. We handed it out to the chiefs. No, absolutely. We'll make sure we get that to you directly. And it's more extensive even than the couple of ratios that Caesar mentioned. It goes through the entire probation staffing and the benchmark ratios and where we are.
Wonderful, thank you. All right, seeing no questions, thank you. Appreciate the presentation. Holly, if you'll introduce our next presenter.
Our next presentation is from Public Defender Randy Mize.
Chair Fletcher, Supervisors, good morning. Let's start with the departmental overview. Over the last 3 decades, the San Diego Public Defender's Office has evolved well beyond our initial Sixth Amendment responsibilities. While we still remain that constitutional check on the government by testing the evidence and holding prosecutors accountable, our responsibilities have grown considerably. The first area of that evolution has been the growth of our work in dispositional alternatives to incarceration. Today, we emphasize a rehabilitation model that aims to return. Thank you, sir. Today, we emphasize a rehabilitation model that aims to return and integrate our clients back into society as productive citizens. The second area of focus that has grown exponentially is our post-dispositional work. Programs such as Fresh Start offer San Diegans comprehensive criminal record relief. Expunging or reducing prior convictions make finding employment, obtaining housing, funding education, and securing other civic opportunities again possible for our citizens. We now receive over 2,200 annual requests for help through our Fresh Start program. Lastly, the incredible proliferation of unfunded legislative mandates from Sacramento. These aim to reverse California's tough-on-crime policies while improving public safety and reducing incarceration at the same time. These mandates come with great promise and enthusiasm, but do not provide any funding for their execution. Highlights. At the beginning of the pandemic, the Superior Court here in San Diego was forced to shut down, with only in-custody criminal cases continuing through the pipeline. With effective collaboration in our local adversarial system, all justice partners came together. Using technology, we were able to implement virtual court appearances, court filings, and remote client visits. That cooperation continued, and we were able to reduce the jail population by nearly 2,000 individuals. Those now out-of-custody cases have been continued to a much later date, and those cases will strain the system dramatically in years to come. However, it was obvious that we needed to do it to save lives. We were able to keep the custody numbers low by creating and revamping the county's bail schedule. We all participated in creating COVID-safe courtrooms, and jury trials have resumed. The court system has become inundated with 7,200 out-of-custody clients we recently arraigned to begin to handle these pandemic-delayed cases. This arraignment accomplishment over a 4-month period has, in most cases, tripled my attorney's caseloads. It will take a Herculean effort by public defenders and everyone else in the justice system to overcome the enormous case backlog. We also have over 700 felony trials that are backed up. We will need to have all those cases tried, and frankly, it could take years to get through that. Public defenders have always been about diversity and inclusion. However, the times have demanded that we establish a diversity and inclusion advisory panel to serve as a direct link between staff and management in order to promote equity and advise me on social justice issues. We have already begun to implement a series of panel recommendations designed to foster equity and inclusion. Looking forward, As our justice system begins to embrace a more holistic approach, my office will need to expand our defense transition unit services. Mental health clinicians, housing navigators, substance abuse assessors, and mitigation specialist investigators are crucial in helping our clients with their housing, treatment, and mental health care needs so that we may successfully, as a community, reintegrate them back into our society. With over 2,200 San Diegans annually asking for comprehensive criminal relief record help, our Fresh Start program must grow as well. Looking forward internally, our office understands the power of diversity and inclusion. We have begun and will increase implicit bias trainings for all staff to develop strategies for enhancing our ability to recruit diverse employees across all job classifications. Performance measures. The backload of thousands of cases that were derailed during the pandemic are the public defender's highest priority. This could have a short-term effect on our key performance measures. It's been difficult to investigate serious cases such as homicides and death penalty cases. Thus, we have been able to settle relatively few of those types of cases during the pandemic. However, we continue to be assigned many of these types of new cases. We have over 130 pending homicide cases currently. As you are well aware, according to SANDAG, homicides were up 37% in 2020. In our 33-year history, my office has never had this many homicides or death penalty cases at any given point in time. That, coupled with the 700+ backed up felony trials and still receiving new cases, will be a daunting task for my staff to handle effectively in the years to come. Unfunded mandates from Sacramento, like the abolition of the felony murder rule, youthful offender parole packages, tiered registration for sex offenders, a minor's right to have counsel present during any law enforcement interrogation, and the Right to Know Act continue to stretch our attorneys thin and will require increased staffing. General fund. I'd like to thank the board, the CAO, and the Public Safety DCAO for understanding the growing needs of your Public Defender's Office. This slide reflects an $8 million budget increase for an overall fiscal year 21-22 budget of $105.5 million. Significant budget adjustments. This upcoming budget calls for a 28 staff increase in my office to address a variety of pressing needs: criminal record relief, immigration, video evidence processing, mental health, substance abuse, and housing needs of our clients, as well as funding for the many state unfunded mandate requirements. Alignment to your framework. Our ongoing Prop 64 conviction relief to reclassify marijuana convictions to misdemeanors or infractions will allow more citizens to qualify for licensing in the cannabis industry. And lastly, the San Diego Public Defender continues to collaborate with the Baja California Office of the Public Defender. Our Baja counterparts provide valuable on-demand support for our investigative units. In return, under the binational agreement of 2015, lawyers from our office provide trial skills training to Baja California public defenders and their investigators. For the last 6 years, their assistance has not only allowed our investigators safer working conditions while working in Baja, but also the ability to obtain official governmental documents anywhere in Mexico more efficiently. And that concludes the public defender's presentation.
Thank you, Randy, for the presentation, and again, the difficult work during and throughout COVID, and pleased to see a continued commitment to increasing your staffing to be able to meet the need as we move forward. Let me go to my colleagues and see if there's any questions or comments for the public defender.
Just real quickly, Mr. Chair.
Yeah.
Thank you. And just Randy, I just want to say thank you very much for the effort. I know with the backlog and all of the things that we've been dealing with COVID and the court system. Thank you very much for stepping up and you know, doing the right thing and taking charge, and appreciate your efforts.
Supervisor Lawson-Remer.
Thank you. Yes, so first of all, I just really want to thank you for all the work and all the service, echoing my colleagues. Just a couple questions. The first is more general and the second is more specific. I think the general question is, does this budget reflect any lessons learned from COVID that you're sort of planning to operationalize moving forward?
It's very interesting. We've been talking to the Superior Court and our justice partners about just that. What did we learn during the pandemic that we can use post-pandemic? And we're looking at some remote work in the courtroom. I'm interested in due process first and foremost, but we've been exploring that and we'll continue to explore that. So we've got a lot of lessons to learn and we've got a lot of catching up to do.
So maybe next year's budget will reflect our lessons learned from COVID.
Could very well be.
Okay. And then my second question is, it didn't appear that the budget currently includes our new, the $5 million for our annual funding for our new immigrant legal defense program. Just want to confirm that that's not yet reflected and will probably have to be in a change letter that we bring.
It is not yet reflected. That is correct. But I'll tell you, you know, we consider immigrants in many ways the backbone of our community, and it would be an honor for us to oversee representing folks facing removal in the federal courts, because they're not getting that representation now, and it's frankly been long overdue. So I thank you for that.
Great. Thank you so much.
Yes, Supervisor, just to follow up on that, that is going to be included in my change letter.
Thank you. Thank you. Thank you, Randy. All right, Holly, you want to introduce our next group?
For our next presentation, I'll introduce District Attorney Summer Steffen, and she'll be joined by Michelle Bush.
And Dwayne Woodley, also, please.
Good morning, Chair Fletcher, Vice Chair Vargas, Supervisors, CAO, and board members. I've been looking forward to this, and it's an honor to be here this morning, and I'm joined by my Assistant District Attorney, Dwayne Woodley, and also our CAO, Michelle Bush. In case there are specific questions, I know between the three of us we'll be able to answer them. So our first focus is the overview of our office at this point in time and our mission. And our mission and focus has changed. In the last 2 years, we've retained the excellence of the past, but we have moved to correct inequities that have happened in the past. And we've put a lot of resources and effort in it by realigning a lot of our internal resources to meet our new mission. Our new mission is to pursue a fair and equal justice for all, and to do it using the 4 Ps method, which is the ethical prosecution of crime, the protecting of victims, and the preventing of future harm, and to do it all in partnership with the community. A lot of what I will discuss really has to do with input and listening to the community that gave us a lot of great ideas. And everything I refer to depends on our almost 1,000 employees that has become one of the most diverse workforce really in the nation and in our county. Just as a small reflection of it, over 70% of our administrative staff reflects diversity of Asians, Black, and Hispanic and Pacific Islander communities. And that's really unheard of in terms of an administration within the county. And that has been a concerted effort on our part in order to specifically address any inequities and to move forward into the future. One of the things that we do that takes up a lot of time and resources and energy It can be looked at as a small task, but it's a monumental task that we've doubled down on, and we've had to do so even more during COVID. And that has to do with our service of over 15,000 victims of crime. And these are crimes sometimes charged, sometimes they're uncharged. And just to give one little example, our workforce is about half SEIU workers, paralegals, victim advocates, and staff, and then we have our DAs, our DA investigators, and that's kind of how, and they have their own associations. But Christy Stevens is a victim advocate, and during the pandemic, as soon as the pandemic hit on March 18th, a young Latina woman was attacked, kidnapped for rape at a community college. And our victim advocate had 8 contacts with that victim to make sure that she received the trauma services, received the care, the referral to medical services, her Marcy's rights, and even more compelling, even though I never dreamed of ordering anybody to do anything like this. This was early in the pandemic where we did not know, and we saw the people dying around us. She insisted on the request of the victim to sit next to her during lengthy testimony to the court. This is one example of what our employees did during the pandemic, where without being directed or ordered, they wanted to fulfill this mission of protecting victims and pursuing a fair and equal justice for all. Some of the accomplishments that we had, and this is, again, a thanks to my team again, that took the vision and didn't stop during the pandemic while facing everything that we face, the same things as Public Defender Randy Mize talked about, the backlog, the converting to all our systems, to new technology, to knowing how to do new things, dealing with 1,000 more victims of domestic violence trapped at home with their abusers during the pandemic. We still converted and dealt with and continued our mission and our vision. Some of the things that are listed there are important accomplishments. The Blueprint for Mental Health Reform brought together 200 stakeholders who were able to lay out 10 solutions. And the Board of Supervisors has moved forward with many of the solutions outlined in the Blueprint for Mental Health Reform. We knew, and this harkens back to my psychology degree, that we need to do better with people who have mental health. We need to be more compassionate. We need to offer more solutions. And some of those solutions are taking flight this year, including 2 crisis stabilization centers that will really provide those families. And I can't tell you the number of parents that have thanked the board and thanked me for pushing forward with this ability to have them walk in to re-up medication any time of day or night instead of waiting for police to arrive when it's too late and the situation has spiraled into violence. Also, along with them, the mobile crisis community, mobile teams, crisis mobilization teams are very important. We also convened Victim Survivors Summit and came up with new solutions that we are moving forward with. The San Diego Opioid Project, which was a collaboration with HHSA that left millions of impressions, but we still see people dying of fentanyl in our area. Our domestic violence shelter technology that for the first time, and we believe this is gonna be a good homeless solution, for the first time placed all 400 shelter beds for victims on one application. And with one call, a victim is able to be assessed and placed, whether she has pets or he has pets, or what their age is, whether their cultural competency, what do they need, and they're given that shelter within minutes, and it is working. When we saw the rise in hate crimes, what we did in San Diego has now become a national model. It was covered nationally on the news as the way you build trust with the community. We built an online reporting, direct reporting to the DA, because we understood from listening to our communities that people sometimes don't know what is a hate crime, what isn't. We wanted them to report everything so we can stop the bullies. In a short amount of time, we've received over 150 reports, and we responded to each one of them, giving them a call by our hate crimes team leader, Leonard Tren, with no additional resources, but this was a commitment we made, and 17 of them were API community. We charged all 3 hate crimes cases, and we tripled our hate crimes prosecutions. We created a student safety in schools reporting system and increased the mandated reporting. These are some of the things, and one thing I'm very proud of, because justice, our first duty as a society is justice, but justice is not only going forward in time, it has to go back. We created a resentencing division. We were the first, again, in the state to resentence on too harsh of sentences. A law passed in 2019, again, an unfunded mandate that allowed prosecutors to resentence past sentences. We've done 6, and we're reviewing 140 petitions. We're working with For the People, a statewide respected organization that goes into the prisons and identifies folks that were sentenced too harshly under past laws. But we also doubled down on solving crime, expanding our cold case division, and again, without additional resources, we received a $500,400,000 grant to add to our cold case resources, and we used those. I want to move forward to some of the key performance measures, and we changed those also, consistent with our mission. Our performance measures focus on what is our success in reducing recidivism. And so we tested a new program, the Community Justice Initiative, that we put forth, and more than 1,000 people have gone through it. It's applicable to all low-level offenses. And this idea came from our immigrant communities, because even a petty theft charge will lose them their green card. And so being able to divert them using evidence-based practices and being able to then seal their record with the help of the public defender was critical. And even though we set the bar at 10% recidivism, I want to let you know today that our recidivism is at 5%, lower than any diversion program in the nation that I've studied. So this is a model we will continue to follow. And other measurements were how many victims we served and the quality of our prosecutions, our felony prosecutions, as opposed to focusing on the numbers. Going to our general fund expenditure, I want to focus here that 85% of our costs are about people. We work for the people. We serve the people, and we only do it by good people doing the job. And I've described my workforce that I cannot be prouder to have. And that workforce has really, I've worn them out with everything that we've asked them to do in our new mission. And we have 992 employees, and I am asking for 15 more employees, and this is even considering the backlog and everything else and all of the new initiatives that I will discuss with you. It's important to note that sometimes people compare not apples to apples. It's important to note that as an example, with the number of homicides, you heard my esteemed colleague say they have 133 homicides. We have a backlog of 209 homicides because we also have to, we are your prosecutor, your people's prosecutor for the private bar, the public, the defender, for everybody. We also, in addition, 30% of the felony cases are never filed, but they are reviewed and an investment is put in them because we're not a rubber stamp. We have to do our job ethically and carefully, and people's lives depend on it. In addition, like I said, we serve victims. We are constitutionally mandated to do so, and we do so. And our duties continue post prosecution. They continue where we work with the state-appointed public defenders for parole hearings of serial rapists and murderers that we have to deal with. So so going to the 15 positions, we have the same backlog that Public Defender Mize described, but we also have many more because we also deal with the private bar like I described. As an example, we have 280 cases pending trial for sexual assault, and we have 209 homicides pending trial also. And these are very serious, and people depend on us to do the job. We're also obviously addressing everything else that goes along with COVID and reopening and all of that. If we can go to the general fund significant budget adjustments, this is where the 15 positions would go. They are going to the One Safe Place, the North County Family Justice Center. And when you look there, you see there's only 5 positions requested. This center will require a minimum of 15 positions, but I've already realigned and worked on how to still have a successful center with that. Workplace justice, again, the workplace justice, we already received 17 tips from the community. Again, this is an amazing effort that we started with Chair Fletcher, and the trust and confidence of the community has led to this unit already in its infancy winning a national award from NACO. The national counties, and being invited to Harvard as the think tank for the best place to start a workplace justice initiative. And so the 4, again, are not all we need. I've just realigned resources and only asking for what we absolutely need from the board. In addition, there's a new law with unfunded mandates of realigning sex offenders. We have 5,000 in the county, and requiring that realignment be done correctly by their tiered registration, and this is a massive effort. In addition to the probation, making sure that, and very little is required there, we've already doing some of the work, and the juvenile diversion initiative, which again, we've realigned resources to meet it, but this initiative will serve 500 youth a year in the community in a culturally competent way. And again, this is the first of its kind in the nation, a DA-led diversion initiative at this level. Going to the next slide, asset forfeiture. We get asset forfeiture funds. They're very strictly limited. We spend them on de-escalation training. As an example, our de-escalation training, before putting forth the de-escalation training, law enforcement had the capacity with PERT to train 300 officers a year. With the being able to fund this effort, we've been able to train 2,000 of our 5,000 peace officers. And we will be on track to train and retrain. And again, this is post-certified, and it's the first post-certified course after the new use of force laws that passed by the Honorable Shirley Weber and others. We also use it for other community-based things, the asset forfeiture. With regard to the alignment to the framework for our future, and I think where we're moving is exactly aligned with where the board is moving, and our initiatives go along with it. As the granddaughter of a survivor of the Armenian genocide, there is nothing that in my blood I want to fight every day more than racism. And this is something that within our office is reflected with the intentional diversity we've brought, with having a chief diversity officer, who serves to make sure that our hiring practices, our promotion practices, everything meets the, not just meets, but exceeds everything that is set to meet the community. We also formed a racial equity committee to look inward and outward. We just had a great meeting yesterday with the core team on this issue. So we're aligning. We've had trainings, multiple trainings, but trainings are not enough. We've moved into action. On the equitable data-driven response, we've replaced stale positions with intelligence officers, and those intelligence data analysts have been able to give us real-time data on where the gaps are, what's needed. They're going to come alongside our juvenile diversion. We've asked SANDAG to come alongside because we want to make sure that we measure racial equity in everything we do. So that diversion opportunities are offered across the board in an even, equitable, race-cognizant way. And the comprehensive harm reduction, that is the model we're going for. So when you look at what we are asking to invest in for the future, which is 1.5 million is all of the additional, we are asking to invest in harm reduction, Family Justice Center, and I know that Vice Chair Vargas also needs that for the South Bay, and we are going to work on that. That's my commitment. With all victims, all communities need these family justice centers where it's a no wrong door, one door, they walk in and get help. And we're gonna, the workplace justice, about worker dignity. Without the DA stepping in, there are cheaters out there. They're cheating employees. They're not treating them right, and we need to hold that accountable through our office. That's another harm reduction model that will affect families and working families. And our juvenile diversion, again, is the huge step towards reducing our school to prison pipeline. So I thank you for this opportunity. I put a lot of this in a midterm report that's published online that has a lot more of the data in order to be transparent with the communities we serve as to where we are. And are there any questions?
Thank you. Thank you, Summer, and appreciate the District Attorney's Office. And again, all you all have done managing through COVID, all of the changes, everything that we've dealt with. And in particular, appreciate the focus on mental health, to have a partner in the DA's office on those issues around substance abuse, diversions, the workplace justice initiatives. There's a lot of really good things, I think, that are taking place there. Let me go to my colleagues. We'll start with Supervisor Wasson-Reamer.
Hi, thank you so much, and thank you for all that you've done and all that your department has done in this really difficult year. Just a couple questions. Building on your discussion of the workplace justice work, I wanted to better understand how that, how you envision this, or what the plan is on connecting that to the new Office of Labor Standards that we've established here at the board. I have another question after that, but let's start there.
No, great. I think that they're going to synergize each other. So the office will be able to get trends, to get reports, to set standards. And our office is already tracking, like the 17 cases, we've put them already in a log of what are the industries where these reports are coming from, where are the gaps. We plan on transmitting that information to the Labor Standards Office so that where you're working is aligned also with where we're seeing the harm, where we're seeing the crimes happen, so that your standards have real-time information as to what we're seeing on the criminal side of the house in terms of misconduct and where those gaps are. So I think that sharing of information, and then my sincere hope is all the studies by the Policy Center and Dr. Green's work indicate that so many people don't report. It's one of the most underreported because they need their paycheck. They need to put food on the table. They're afraid of retaliation. So while I can't do this, the office, your Office of Labor Standards may be able to have a restitution fund that allows those victims to be able to report and still be able to put food on the table, and then we can stop the abuse and not let it continue. So I see a lot of intersections because I'm already studying the data. We had a meeting yesterday with our labor advisors, our Employee Rights Center, and we shared that preliminary data, which was already eye-opening. But as you know, as a data queen, if you will, that it takes a year to really get a good idea of what we're looking at.
Thank you very much. And my second question is, just wanted, you mentioned a number of initiatives that sort of touch on this, but it would be helpful for me if you could kind of summarize in like one place the work focused specifically around environmental crimes. As you know, one of big priorities of this board is sustainability and environmental justice, and it would be helpful to just better understand how, if there's any changes in the budget or other things that we should be aware of from a budget perspective, particularly focused on environmental crimes and environmental justice enforcement.
Yeah, thank you for that. So I really tried to ask for only the very much, because I know there's so many demands on the board, what we need. And in environmental justice, which is a huge commitment for us, and we've taken on, large organizations, Target, Best Buy, we're not looking for, people who are negligent, who make a mistake. We're looking for the big fish that are, destroying, taking shortcuts, throwing batteries to save money without, and destroying our environment. We get grant funding for that because it goes into a fund, the restitution. We're dealing with massive companies, so they actually pay the restitution that goes into a fund that allows us to keep our prosecution strong. So I will not be cutting into that in order to meet the backlog. But I'm not asking for additional because we have that where we're doing good work and we're holding companies accountable monetarily, and that money is going back to fund further prosecutions.
Great, thank you. I just, my mom spent much of her career prosecuting environmental crimes, so for this county, so very close to my heart, and thank you for the work.
Thank you.
Thank you, Supervisor Wasserniemer. Any other questions from any other colleagues? All right, not seeing any. We thank our district attorney
Thank you so much.
And team for the presentation, and we'll go to Holly to introduce the sheriffs.
All right, our final presentation will be from Sheriff Bill Gore, and he'll be joined by Eunice Ramos.
Cleaning solution out of the way here. Chairman Fletcher, members of the board, thank you for the opportunity to be here this morning. The Sheriff's Department's 4,600 employees operate 7 detention facilities, 18 patrol stations, which includes law enforcement services for 9 contract cities, as well as providing court security services for the region's courthouses. We also provide regional investigative support and tactical emergency response, as well as operating a regional crime lab. This slide highlights some of the many department accomplishments in 2020. Looking forward, the Sheriff's Department continues to transform the way we do business. We are changing our focus to better incorporate new methods to ensure improved outcomes for inmate medical and mental health care, which will translate to safer communities as we release individuals who will have a greater chance of being successful as they return to our neighborhoods. Increase to the Sheriff's budget will allow us to add resources to expand medical care and enhance access to mental health services throughout the jail system, and to open 3 housing units and dedicated medical facilities in the Rock Mountain Detention Facility. These actions continue the department's progress in achieving National Commission on Correctional Health Care accreditation by adding much-needed medical and mental health care staff to our jail system. The addition of beds and staff also facilitates jail system compliance with the Board of State and Community Corrections capacity requirements and makes it possible for the department to carry out critical repairs and major maintenance at aging jail facilities. All these additions ultimately support safe operations for individuals in our custody. This investment will increase medical and mental health care staff by 141 positions, allowing 24/7 health care coverage in our facilities. The increase of deputy staffing will facilitate the 24/7 health care by providing appropriate security for all staff and in-custody individuals. These investments support the goal of improving outcomes for individuals returning to our communities and improving overall public health and reducing recidivism. This slide shows key performance measures. These performance measures reflect the level of services we provide. Some measures show those services we are requested to provide, such as jail bookings and public calls for service. Other measures are reflective of activity related to an operational goal, such as mental health encounters. This measure encompasses psychiatric appointments, psychologist and mental health clinics, inmate safety program clearances, intake assessments, and group therapy. This is indicative of the volume of work performed by both Sheriff's mental health staff and mental health contract staff. Now I'd like to introduce my Chief Financial Officer, Eunice Ramos, who will go through the budget presentation. Eunice?
Thank you, Sheriff. Good morning, Chairman and members of the board. I will be going over the Sheriff's Department operational plan, highlighting significant budget adjustments and reductions. The CAO recommended operational plan for the Sheriff's Department is $1 billion in the general fund and $1.1 billion including all funds. Thank you. This is an increase of $79.7 million or 8.1% from the fiscal year 2021 adopted operational plan. The operational plan also includes staffing of 4,636. This is a net increase of 255 staff years, or 5.8 from the fiscal year 2021 adopted operational plan. The composition of the increase includes 94 sworn and 161 professional staff. 141 positions are being requested to provide medical and expanded mental health services for individuals in custody. The staffing request will be discussed in more detail in a later slide. The Sheriff's Department operational plan is displayed by bureaus. This chart includes the staffing and budget for the general fund. This chart includes the budget for non-general funds, which includes the asset forfeiture program used to account for funds collected from seized assets, jail commissary enterprise fund used for the operation of the Sheriff's Commissary, inmate welfare fund used for the benefit, education, and welfare of inmates housed in the detention facilities, and county service areas used to account for costs associated with the regional communication system. There are no positions included in these funds. Next, I will highlight significant budget adjustments within the general fund and non-general fund. The renovations at Rock Mountain Detention Facility are currently underway and anticipated to be complete in March 2022. 191 positions are requested in order to operate 3 housing units in the renovated facility. The staffing model includes 124 sworn, 45 medical and mental health positions, and 22 other professional positions. The first partial year's cost is $26.1 million, which will be funded by $22.2 million in general purpose revenue and $3.9 million in Proposition 172 to support one-time costs associated with the positions. 51 nursing positions are requested to meet the current and future program needs and provide the necessary coverage for detention operations. The phased hiring continues the department's progress in achieving National Commission on Correctional Healthcare accreditation. The additional positions will result in a total cost of $8.8 million, funded by $8.4 million in general purpose revenue and $400,000 in unassigned general fund balance for the one-time costs associated with the positions. 45 mental health positions are requested to better provide access to care for patients with mental health conditions, allow inmates at intake facilities to be evaluated upon admission for mental health risks for appropriate housing placement and treatment, and provide more programming classes for patients and enhanced discharge planning activities. The additional positions will result in a total cost of $7.2 million, which will be funded by $6.8 million in general purpose revenue and $400,000 in unassigned general fund balance for the one-time costs associated with the positions. Together, the 141 medical and mental health positions total $20.1 million. On January 27, 2021, your board approved the development of a new cannabis program. In order to set up the enforcement team to immediately and aggressively address the unlicensed, illegal dispensaries, labs, or any related operation facilities, the Sheriff's Department will be requesting 6 positions. This will result in a total of $1.6 million, funded by $1.2 million in general purpose revenue and $400,000 in unassigned general fund balance for the one-time costs associated with the positions. Assembly Bill 732 was approved by Governor Newsom on September 30, 2020, which provides services for incarcerated pregnant persons in county jails and prisons. This increased contract cost totaling $500,000 will be funded by State Community Corrections subaccount. There is an increase of $20.3 million associated with the required retirement contributions and negotiated labor agreements. This will be funded by program revenues, including Proposition 172, which includes both ongoing revenue and one-time funds. We are using Proposition 172 fund balance in the fund to allow for stabilization in Proposition 172 program revenues required to mitigate the absorption of this cost. We have identified $10.6 million in major maintenance projects throughout the facilities, which will be funded by unassigned general fund balance. These funds will support major facility improvement projects, primarily in the detention facilities. On March 2nd, your board directed the Chief Administrative Officer to develop a board policy that prohibits the county from entering into agreements to charge incarcerated persons for communication services, including telephone, messaging, and video visitation, and to prohibit the county from generating operating revenues from fees associated with communication services. Under the current inmate telephone contract, we receive an annual guaranteed revenue of $2.6 million. $7.5 million in general purpose revenue will backfill the $2.6 loss of this revenue, as well as provide $4.9 million for the additional contract and infrastructure costs to provide free inmate communication services starting July 1st, 2021. There will be an increase of $3.4 million associated with ongoing facility costs to operate Rock Mountain Detention Facility, as well as increases in other facility and fleet costs. This will be funded by Proposition 172 program revenue. Support and care associated with providing medical services for inmates in the detention facilities are increasing by $1.4 million, which will be funded by Proposition 172 program revenue. In June 2020, the Sheriff's Department entered into a memorandum of agreement with a nonprofit organization, Lucky Duck Foundation, to assist with feeding the unsheltered through June 30, 2023. This agreement will provide up to 1,000 unsheltered individuals with 2 daily meals and result in $900,000 program revenue to support this program. As of July 1st, 2021, counties will no longer be able to assess a fee to participants in the home detention program for electronic monitoring. The department plans to support this alternative custody option funded by $800,000 in State Community Corrections subaccount. Next, I will go over some major budget reductions. We are decreasing 40 positions to reflect the change in the level of service provided for court security, which more accurately reflects the funding provided by the state of California. The Memorandum of Understanding was developed by the Sheriff's Department and the court. The MOU states that the number of personnel can be adjusted based on operational needs and the amount of available funding. This will result in a reduction of expenditures totaling $5.1 million, previously funded by general purpose revenue and State Community Corrections subaccount. The savings of $4.2 million in general purpose revenue will be used to bridge fund the loss in revenue associated with the economic impacts of COVID-19, which was backfilled by unassigned general fund balance this past year and supported ongoing expenditures. In the crime lab, we are decreasing 3 positions due to a reduction in Proposition 69, the DNA fingerprint, Unsolved Crime and Innocence Protection Act revenue, which supports DNA analysis. These funds have previously funded 4 critical positions for this effort, but with the continued revenue decline in the past years, we can only sustain 1 position. Lastly, this slide reflects the Inmate Welfare Fund's reduction of $2.6 million revenue from the current communication contract associated with the no-cost communication services for incarcerated persons. The revenue source has been replaced by general purpose revenue reflected in the earlier slide under significant budget adjustments. I will now turn it back to the Sheriff to go over the framework for our future.
Thank you, Eunice. The department has developed more accessible portals for customers to obtain Sheriff's Department information. The information includes government QA and a Senate Bill 978 webpage. All inmates in the sheriff custody have been offered COVID-19 vaccine, and we offer it to everyone at intake. As of May 22nd, 2021, 6,386 inmates have been offered the vaccine, and 2,521 inmates have accepted the offer and have been vaccinated. There have been 15,469 tests administered for COVID-19, with 1,288 of those being positive. In closing, the added resources of medical and mental health care staff will improve outcomes for individuals in sheriff's custody and those returning to the community upon release. All of this supports the sheriff's goal of public safety and better treatment of individuals in our custody. I'll turn it back to Holly, or entertain questions first. Holly?
Questions?
That concludes our presentation. I'll take any questions.
Thank you, Sheriff. Thank you for the presentation, and we'll start with Vice Chair Vargas.
Thank you so much, Chair Fletcher, and thank you, Sheriff, for all the great work. Quick question I had was, the first one is, how long are we intending to keep the current COVID-19 booking procedure in place for our county jail facilities?
We're looking at adjusting that as the COVID pandemic and the numbers come down. We're looking at adjusting our booking criteria. As we speak, we're getting a lot of inquiries from other law enforcement agencies around the county and other public officials that are concerned with our rather narrow booking criteria right now, so we're looking at adjusting that. We obviously tighten that criteria up to bring the numbers down in our jail, which we did from, I think, pre-pandemic numbers of around 5,600 down to a low of 34. We're running about 4,000 inmates a day right now. My personal belief is our booking criteria now it was good for the pandemic. It's not good for overall public safety in San Diego County. I think there's people out there that that need to be in jail, to be quite honest, that our booking criteria doesn't allow right now. So we're in the process of examining that as we speak. Okay.
And then with relation to the cannabis education unit, I know there was a mention to $1.6 million, I think?
I'm sorry, I can't quite
I'm sorry. I think there was, with related to the 6 additional deputies for the cannabis education unit, I think there's a $1.6 million, I think is what you said. Can you tell me more about the justification for the 6 deputies?
The specific what?
The 6 additional deputies for the cannabis eradication
You mean
unit.
the specific job they'll be doing?
Yes.
Yeah. There's, as we move to, well, it's not a new problem, but as we move to possibly legalize recreational cannabis in the county and unincorporated, we have a terrible epidemic of illegal dispensaries, I think, not just in unincorporated, but throughout some of our contract cities and other places in the county. This team will work with our code enforcement people, with the district attorney's office, to eradicate those illegal cannabis dispensaries. Right now, they're dramatically impacting, I think, the amount of revenue that's taken in from the legal cannabis, because if you can buy it cheaper at the illegal one, that's where you're going to buy it. So I think it'll offset, and hopefully the revenues from the legal cannabis dispensaries will increase. So I think it's long overdue, and I appreciate the board's support on those deputies to handle that enforcement.
Sheriff, if I may add, it includes 4 deputy sheriffs, 1 sheriff sergeant, and also 1 crime and intelligence analyst, if we want to get specific with the position.
And thanks for pointing that out, Holly. That's a critical part of everything we try to do is do the analysis first, and so we're not just responding to different and putting out fires in a whack-a-mole. We have the analytical capability to really focus our investigations. We have an analytical capability in the Sheriff's Department that's second to none in California, and I credit them with a lot of the successes we've had in keeping our crime rates down. So I think they are going to be an integral part of our cannabis eradication project.
One thing, Vice Chair, if I can just add to this, Sheriff, when our board moved forward with the development of an ordinance around a legal framework for recreational and medicinal, we did add in $500,000 in funding for Sheriff's Department for enforcement on non-authorized, non-legal, non-permitted facilities. And so 500,000 of this was what we had included as a board to the Sheriff's Department. We do that, and then the other 1.1 would be a requested increase of that $500,000 from the sheriffs in the budget.
Okay, thank you. And then the last question was around the, I know there's been a lot of discussion about our health, staff in our county jails, right, to address some of the challenges. So just wondering if, will it continue to be, is it a partnership with HHSA, or are they going to continue to be housed under the Sheriff's Department, or what are your thoughts on that?
The 141 will be sheriff's employees, but I'm really happy to say that we've got a great collaboration with HHA, specifically Dr. Luke Bergman in behavioral health, working collaboratively with HHSA on an intake of our inmates and a better assessment of them from a mental health perspective, and also working with them on placing the inmates when they come out of our facilities into that continuum of care out in the community. Like I say, I'm really excited about the collaboration. It's been, I think, seamless, and I expect it to continue that way.
Okay. Thank you very much.
Thank you. Supervisor Lawson-Remer.
Thank you. A couple questions. One is just building on the question of my colleague, Vice Chair Vargas. She asked about booking criteria. I was wondering if you have any analysis underway to assess whether there's certain individuals who were released according to COVID guidelines or not booked according to COVID guidelines that have not posed a public safety threat over the last, so say 14 months or so, that we might consider continuing those same booking guidelines moving forward. And the corollary to that question is, along with that analysis, whether you're also looking at budgetary implications of potentially changing some of those booking criteria.
And we are tracking those numbers, Supervisor Lawson-Remer, as far as repeat offenders, people who have been released early on my authority or shorter sentences, and people that weren't booked under the new booking criteria. I think we have those numbers to provide to your staff as far as the number that have reoffended in that time frame, and we try to learn from that, obviously. But there are, like I say, there are some classifications. The one that always comes to mind, and it shocked me, to be quite honest, was a case of an individual in a stolen car that ends up a high-speed chase with law enforcement and got a citation for that at the end of the chase. So we're looking at it. We're taking it very seriously. I don't want anybody in my jail that doesn't have to be there. Our primary goal is to have people in there that are a risk to the community or a failure to appear at a later date in court. Those are the two risks I'm looking at. I don't want to have people to be economic inmates that just because they can't afford a bail and they're really not a threat to the community, they're sitting in my jail. That's kind of our guiding principle.
Thank you. And my second question is a follow-up to the action this board took a few months ago regarding free phone calls for inmates. I'm just wondering what your plan is to ensure that families and individuals are being informed that beginning on July 1st, communication services will be available at no cost.
To be honest with you, I don't know what we're doing as far as public outreach, but I can get back to you on that. I'm sure we'll have a robust public information campaign of that. The challenge that we're facing now, and we're coming up with the criteria of access to the, it's going to be, we can't just make it unlimited. You have some inmates that would spend 8 hours talking on the phone. So we're trying to come up with an equitable policy of maybe limiting calls to 15 minutes every 2 or 3 hours. Those are the policies we're working through right now, Supervisor.
Okay, yeah, I would be very helpful to be better informed on the implementation plan to inform inmates of the opportunity for free.
We've already had an editorial written about it, so I'm sure we'll get you the information. So.
Don't know that our inmates are reading those editorials, so thank you.
Thank you.
Vice Chair Vargas.
Just to follow up on that one, I was just trying to find out, has there been any updates, or have we been following up on making sure that we, I know we had talked about the CPUC funding to subsidize some of the expenses, specifically around telecommunication for jail facilities. So I'm just wondering if maybe it's a question.
I am unaware.
Okay.
I believe the Office of Strategy and Intergovernmental Affairs was working on a letter in support of CPUC action that would result in funding for that.
Okay, thank you very much.
Hopefully result.
Thank you, Vice Chair Vargas. Sheriff, I've got two questions. One, I know we have spent many months in many meetings working out the increase in clinicians with county workers, going into our facility with clinicians, mental health, drug treatment experts, and I appreciate that work. I know it has been a heavy lift over the course of the last 4 to 5 months in the engagement that's happened. I appreciate the MOU that we're working on to really delineate to Supervisor Lawson-Remer's question, the relationship between the behavioral health services provided by Sheriff's Department employees, but in coordination and collaboration with behavioral health services under Health and Human Services, and a particular focus on those rapid turnaround individuals, those 72 hours in and out, and doing everything we can. It's very hard to do robust assessment. We know our crisis stabilization units, sometimes it takes more than 72 hours to even evaluate what's really wrong. And so I think the efforts that we're doing there by adding the clinicians with a focus on mental health and drug treatment, the integration in that with not only with county behavioral health, but as you pointed out, Sheriff, the connection to ongoing services. Our goal is to have people not come back.
Absolutely.
And I think that these are efforts that if we do right and we really case manage right and we care coordinate well and we connect to housing and services afterwards, I think we can actually significantly lower recidivism. And so I appreciate that work and that effort in those 141. The one question
and that
I have,
collaboration as recently as yesterday in a conversation with Dr. Berkman, who was back east, unfortunately, and looking at the MOU and tweaking the wording. So future employees, who they were sheriff's employees, and it's a work in progress. But I think it's definitely a collaboration. We're on the same sheet of music.
And we've come a long way. We've come a long way around these discussions.
And that's so key to what you've heard me say 1,000 times, a third of my inmates are on some type of psychotropic drug. And we've just got to stop that revolving door, and so we can get them the help they need and maybe get them stabilized. But the key is going to be, I think, hooking them to the resources and the services in the community so they continue to get that care and not come back in. And more importantly, that keep them from coming in the first place with mobile crisis response team, crisis stabilization units, all the things you're working on, which I applaud.
No, and I think we've got a overarching goal as a board to reduce the number of people that come into your custody. And that does start with mobile crisis response teams. It comes with efforts of our DA around diversion. It comes with all of those things we're doing to reduce the number of people who come into your doors the first time. And then if they do come in your door the first time, we don't want them to come back. And so we're making investments on both ends with the goal of lowering the total population that we have by diversions out of the gate and by lowering recidivism for people who come back. And so I think these are positive advancements. I'm also mindful that it is a difficult workforce to hire. We have a critical shortage of behavioral health and drug treatment folks available, and we're doing some broader efforts around behavioral health workforce. But I know, we can say 141 clinicians here, but I know it will be challenging as we get those hired and
nurses
trained.
aren't easy to hire either.
No, it's very, very challenging. So I get that. But Sheriff, my one question was, do these positions, will this cover the medication, medical assisted treatment programs, and is that included in the 141?
My understanding, the 141 does not include the MAP. We're looking at that and working again with HHSA and our medical people and the intentions to come up with a number for you. I know that's an ongoing, hopefully we'll have that very shortly.
Okay, Helen.
Chair, yes, it is not included right now.
It's not.
We are working with Dr. Bergman as part of the additions that we're putting into the change letter. So we're still working through those discussions.
Yeah, and I think that's really important because we're not going to have a comprehensive approach to behavioral health without those MAT services.
Right.
And I think that those are vital and those are very important. And as we go between now and final adoption of the budget, working to incorporate those in, I think is essential. I mean, if you don't have both the mental health and the drug treatment, it is the combination of both and the co-occurring rates and the number of individuals who arrived at that intoxicating substance due to an untreated and undiagnosed mental health issue, but they're still addicted. And so you've got to really treat both of those. And so I look forward to seeing that come back and where we go. My second question, Sheriff, if you can walk through, let's talk about Rock Mountain for a minute. If you can walk through the breakdown in the number of sworn deputies being added for Rock Mountain, along with sharing the rationale for why the addition there, and then what the cumulative incarceration capacity will be with the facilities when Rock Mountain is done, and just give us some context around what's happening
And
there.
I can't give you the exact numbers, maybe Eunice can, but I can tell you the general philosophy of why we can't, if we're going to do renovations at George Bailey, why we can't just take 200 inmates and those deputies and put them in Rock Mountain, and why can't we just do, because if you're going to open a facility like Rock Mountain, there's more to it than just and some of the supervisors that are down there touring, there's more to it than just the deputy that does the safety checks on the inmates. You have to run the facility, and that takes additional bodies. And if we're going to increase the medical care, which our plan definitely calls for, you have to have additional deputies so that those nurses and those mental health clinicians, as they make their rounds to the inmates, are protected and secure. Eventually, when we get through the maintenance at George Bailey and Vista, and use Rock Mountain so we can accomplish those two very long overdue major maintenance projects, ultimately our goal is to then close South Bay, which is 400 beds. And that would, I don't see right now us using the full capacity at Rock Mountain, but when we close those 400 beds and we've done all our maintenance, then we can take those 400 bodies at South Bay and they will be at Rock Mountain. But if you want specific numbers, I can get those for you.
Yeah, that would be helpful. And then
She's
just
got 'em.
one addition, just so you can answer both at once. One is on the staffing issue, but the second thing is, I'm just curious, our total correctional capacity today, what it will be when Rock Mountain comes on, with the various adjustments you make on spacing, and then what we project it to be when you close South Bay. So kind of where we are today, where we'll get to, and where we think we'll be when we close South Bay.
Okay, I'll just hit the big number. If we close, I think Rock Mountain has a total capacity of 1,000 beds, if I'm not mistaken. I don't see us using all 1,000 beds, but you can't, we had to renovate. It doesn't make sense to renovate 400 beds. What I see when we close Rock Mountain, I see us having, when we close South Bay, having 400 to 500 inmates, half capacity at Rock Mountain. Now that could change. It always could change depending on, societal changes, everything else. But go ahead, Eunice.
To answer your question, Chairman, there are 124 sworn positions being requested, which includes 114 deputies, 9 sergeants, and 1 lieutenant.
Okay. And then what is our current correctional capacity today without Rock Mountain?
Without Rock Mountain, I think the bed capacity is like 6,000 total beds, but you can never fill up all those beds. Bed capacity doesn't equate to total number of inmates you can house, because you can't utilize every bed because of classification issues. You can't put your shoplifter with your murder and all those issues. So
the actual
when you get to
capacity
about
numbers.
80% of capacity, you're full.
Got it.
We also have an issue with triple bunking.
Yeah,
that we
that's
have-
BSCC.
We have to get into compliance with that
We
as
can't
well.
comply with the Board of State and Community Corrections as long as we're continuing to triple bunk. And that's the big thing. There's that issue. And then the other one, which we didn't really talk about, to get the NCCHC accreditation, we have to go to the primary care of medicine. That's why we're asking for those 80 some odd more nurses. And a primary care of healthcare means instead of having a nurse at George Bailey go from one module to another module handing out pills, she has a module. She takes ownership in the care and the custody of that individual. It's just a better form of medicine than what we're doing now, but that takes more resources, and that's why we're requesting the additional nurses, and plus to address other mandatory overtime issues we've been faced with.
Got it. Do you have a projected or estimated date of closing the South Bay detention facility?
It will be years down the road, because George Bailey renovation, Vista renovation is going to take time. I don't have an exact, I would say a couple of years maybe.
Okay. But
That's
like,
just a guess.
I'm just guessing, Sheriff, I'm not
Yeah.
trying, but we're talking within 5 years or
No,
within 10 years?
I'm thinking 2 to 3 years.
Okay.
That's
we would close.
I guess.
Chair Fletcher,
Hopefully.
there's a study by Department of General Services to look at facility needs. There's some really incredible infrastructure issues at George Bailey, things that are very fundamental to the operation of the jails, such as plumbing, electrical,
You
the
talking about
security
Vista or
systems.
George Bailey?
George Bailey.
George Bailey.
And Vista has significant issues also.
And so they're looking at whether or not Vista actually needs to be replaced.
Right.
And so there's a question of whether or not it's worthwhile to make the necessary improvements to that facility, or if it needs to be leveled and a new one needs to be built. So they're in the process of that strategic planning process to look at the facility system-wide and kind of come up with a construction plan. And Rock Mountain, again, is that relief valve so that the inmates can be transitioned to Rock Mountain while those renovations take place. The sheriff mentioned the bed capacity. 600 is what the current budget staffing is requesting. 600 is the
For Rock
capacity at Rock Mountain. Yeah, and South Bay is 400 beds, and so it doesn't have the capabilities for medical and mental health that are needed. So that's the one they want to close because it's just not built to have the infrastructure for the medical and mental health needs.
I think, thank you for that. I'll come to Vice Chair Vargas next, but I think it is going to be of, I think, interest to the board as we move forward, as we look, what is the capacity we actually need? And not overbuilding and overstaffing the capacity that we actually think we need. And so as we take into account kind of where we are, where we're going, what is the alignment of George Bailey when renovated, Rock Mountain when online, what is the need? How many beds are actually needed at Vista? How many beds are needed system-wide? And I think that's going to be a particular interest kind of as we move forward. Of course, we want to get out of triple bunking, and we want to do all of the things to ensure the proper health care, the proper treatment, the mental health care. I think we understand the nature as we add a lot of clinicians, right, that in that environment there will have to be some corresponding capacity to ensure the safety of those folks in that facility. And I think, when we make a commitment to say, hey, someone comes once, we don't want them to come again, then, I think we get that. But I think it'll be, particular interest in just the capacity that we are building out and investing significant sums of money as we move forward. Will probably, be an ongoing area of interest.
The sheriff mentioned the return to custody in the pandemic. It's 44%. And we'd love to see that number reduced. 44% of people who were released as a result of a mitigation action from the pandemic came back to the jails. That's a huge number. And so I think, adding the resources in medical and mental health and the collaborations with HHSA hopefully reduces that number. As a criminal justice system with the sheriff, the district attorney, the public defender, the courts, we've also had discussions about exactly what you addressed with, what are the charges that maybe the person doesn't belong in jail, and public encroachment and public intoxication and some of these lower level misdemeanor offenses. What are the other solutions that we could pursue? And, we heard loud and clear that sobering centers, in addition to crisis stabilization units and mobile crisis response teams, there are frankly just sometimes no other place for those individuals to go. And I don't know if the sheriff wants to add.
No, and that's in a conference call we had with our justice partners. That's the main thing. We're the only game in town. Where do you take the person that maybe is not a threat, but they're, high out on drugs or drunk in somebody's front yard or front porch? There just aren't enough beds other than the jail, and that's the pressure we get from other cities around the county. When are you going to open up your criteria? Well, I would like to have alternatives. I would love to have more serial inebriate centers where people go in and get sober and not go into our jails. So.
I think, Sheriff, and then we'll go to Vice Chair Vargas. I think all of what we've got to look at is we tend to, as we think about rebuilding or renovating, we tend to think about what we have today, or what we think we may need today, right, or pre-pandemic levels. And then on the other side, we talk about all these efforts, mobile crisis response team, crisis stabilization units, sobering centers, that DA's efforts around diversion, that if we do those right, then maybe we don't need what we have today, right?
No, those are conversations we got to continue to have.
Exactly, and so, or even the investment of clinicians. I mean, if we make this massive investment in MAT, in clinicians, in connections to ongoing services, and we don't actually lower recidivism, then shame on us, right? Because it hasn't worked right. And so as we look ahead towards the future capital needs, I think it's going to be really important that we monitor those programs and we begin to quickly evaluate their success in lowering, one, in diversion, and two, in lowering recidivism, and have that guide our infrastructure investments moving forward. Because if we're successful in this and this, then we won't need as much of that.
And we'll be able to track that with our booking numbers. Let's see what's, maybe they're
And we'll
not
be
coming
able
in
to
the
see.
front door. Wouldn't that be great?
And so I think as we look ahead towards discussions around Vista, South Bay coming offline, I think that's where we're going to have to have a hard look on what is the capacity we're actually building out, and where that goes. But let me go to Vice Chair Vargas.
Yeah, and thank you for that, Chair, because I was thinking about, and this is a question I did not ask earlier, is 119 the standard number that you need to be able to run the facility, the Rocky Mountain facility? Is that
So
just
Rocky
to be able to
Mountain,
open it up, I guess is what I'm asking.
Rocky Mountain, the request is 124 sworn.
Okay.
That includes 1 lieutenant, 9 sergeants, and 114 deputies. That's the sworn staff, not the professional and medical mental health staff.
Yeah, so, but that's the minimum amount that you
Right,
need to
and
be
that's
able to.
anticipating how many inmates with that number at Rock Mountain?
600, so that's to staff a capacity for 600.
Okay. And then, I did tour the facilities, right? And I don't know right now that there is some of that sort of ability to adjust for any type of future, the need to really reduce the number of people who are incarcerated. And, I've also, been able to have the opportunity to tour Las Colinas and some of the other ones. And so I'm wondering if particularly, there seems to be a lot of opportunities or more opportunities, particularly around reducing recidivism for women in some of the, Las Colinas and the programs that are being done. I don't see that a lot in some of the male facilities, and I'm not sure.
Have you been to East Mesa? That's where we do our primary reentry programming for our male population, is at East Mesa. That's right next to George Bailey. Yeah. Wouldn't it be great if, in fact, we are going to build a new North County detention facility of some sort, that it looks more like Las Colinas than downtown Central Jail?
Yeah,
I mean,
I also would like to emphasize that I would like to see that in South County because it's really hard for people to visit their family members. Yeah. And I'm hoping that our goal is to reduce incarceration of the members of the community of South County, which tend to be,
I would invite you to come visit East Mesa. I mean, it's not Las Colinas. That's state-of-the-art, one of the best in the country.
I visited that one
East Mesa is it's a very nice facility.
All right, thank you.
Thank you, Vice Chair. Supervisor Desmond.
Thank you, Mr. Chair. Appreciate it. And I just want to say thank you to Sheriff Gore and all the, the work and effort you're doing. And after myself and Supervisor Vargas, we had a tour of George Bailey there. It really kind of pointed out the, the need for facilities, newer facilities, and some of the old wiring and things like that in the in those facilities, and the, kind of the old mechanical 1960s data or era of electronics as far as opening doors and things like that, was really, kind of hit home. And I appreciate the fact that you have to juggle. You have to, if you renovate one jail, you got to move the inmates back and forth. And the fact that you're putting more more people, can deal with the mental health issues. Unfortunately, you're still the biggest provider of mental health services in San Diego County. The fact that we're putting in more effort to the hopefully keep people that are mentally ill out, and hopefully keep the criminals in, but the mentally ill, if we can help them in any way, shape, and form, and through the jails. It's unfortunate when they get there, but thank you for your effort in trying to alleviate behavioral health in the area. So I want to say thanks.
Well, I thank this board really for your support of the nurses and the mental health clinician. This will allow us finally to provide, I think, first-class medical and mental health care for the inmates, which is what we're all about. So, thank you.
Thank you, Sheriff. Not seeing any additional questions, Sheriff. Thank you to you and your team. At this point, we're going to go to our public speakers on this item. I believe we have a few public speakers, and then we'll come back to Holly and team after the public speakers for any final or closing thoughts. And then I think it's the intention, I believe we only have 4 speakers, that we would then transition into Health and Human Services and get through the introduction, probably go up somewhere between 12 and 12:30 and then take a brief break. But once we get through public speakers, any final thoughts then we will transition directly into Health and Human Services. We'll call forward the speakers at this time.
Thank you, Chair Fletcher. Yes, we have 4 individuals that have requested to speak by phone. Any members of the public that requested to speak on the Public Safety Group operational plan, please dial into the conference line now using the instructions that were provided to you. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record. You will have 2 minutes to address the board. I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. We'll begin with the first caller, last 4 digits, 8466.
Hi, my name is Isabel Rosales, and I'm calling, I'm from San Diego County. I'm part of the San Diego District Attorney's Office, and I would like to speak on their program and how great their program is and how much they influenced my life during my recovery. I call it my recovery. I am a domestic violence survivor from 2018, and their attorneys, their advocates, all of their staff, very helpful. They walked me through every aspect of every part of the whole getting him prosecuted. It took 19 months, and I live out here by myself with my 3 kids, so I don't have any family. They made me feel so protected. They answered every question. They walked with me every step of the way. They made me feel so, they made me feel like family. They made me, they helped me trust that we were gonna take care of this situation. He wasn't gonna get away this time. And I was finally gonna get justice for myself and for my kids. And I am eternally grateful for the District Attorney's Office for what they were able to accomplish. And I vow to always help the District Attorney's Office with any other victim and survivor that they have, because I want to be able to show what the office is able to do for others the way that they have done for me. So in any way that I can.
Thank you. Our next caller is 9358. 9358. Please press *6 to unmute your line. 9358.
Hi, my name is Angelina Corsani from the Center on Policy Initiatives and the Invest in San Diego Families, or ISDF Coalition. This year's public safety group budget reflects a significant net increase, with the Sheriff's Department being the largest driver of this increase. Some of these changes, like investments in public defenders, programs for domestic violence survivors, and the Workplace Justice Initiative, reflect adjustments to better align with community needs. Increases in the Sheriff Department include the addition of 141 mental health clinicians and nurses in detention facilities to address massive understaffing of healthcare services in county jails. While some of the investments reflected in this year's proposed budget will support much needed shifts in our approach to public safety and more humane conditions for individuals incarcerated in our jails, they also represent continued investment in an outdated and racist system of policing and imprisonment. As this county continues to move in a new direction, we hope to see a commitment to the fundamental and transformative changes that our communities need. Transparency is an essential part of this shift. The budget does not provide clarity on key questions that the public should have answers to, such as why these new healthcare positions need to be housed in the sheriff rather than in the HHSA department, a thorough explanation for the significant increase in sworn deputies, what jail-related capital improvement projects are being planned for the future, and how lessons learned from COVID-19 will be incorporated into operations moving forward. We've shared some of these questions with the supervisors and hope they will be addressed today. We appreciate the addition of these hearings and look forward to increasing transparency and accountability for county public safety departments. Thank you for your time.
Thank you. Our next caller is 5993. 5993. Please press *6 to unmute your line.
Hello, My name is Gerald Vincent Jones. I'm calling San Diego, California, on behalf of Summer Stephan and in her office, the district attorney's office. Their program is phenomenal. They're doing groundbreaking work right now. I was recently released from prison on the 20th of May. I was sentenced to 30 years, enhancement laws, the prison priors, gun enhancements. Anyway, did 15 years on a 30-year bid. And Summer Stephan's office gave me a second chance, which is crucial in this time because I'm a voice that would be listened to, respected, and heard in my community. And I've learned some things when I was incarcerated. It didn't take the whole 30 years for me to learn these things. I've learned these things earlier. I did some self-reflection and created my own greeting card company, through the 5 Ventures and other organizations that deals with inmates with the reentry and less recidivism, for inmates to be returning back to prison. They teach us entrepreneurship and business skills. And so basically I created the first and only company in the United States that only specifically catered to those incarcerated. So we speak from a different perspective, as well as the family members. But I've learned that I've created my company. I'm starting to get contracts with several different prisoners throughout the state of United States, and it's all because of me getting the second chance. So, and not only that, I want to go ahead and start some type of a program to where that we can teach the kids, 7th grades and 8th grades, the same skills and life course skills that was crucial to my success. If we can go ahead and give that to those same individuals, they'll learn, and then they'll go ahead.
Thank you. Our next speaker is 8245. 8245. Please press *6 to unmute your line.
Hello, hi. I think I finally got it to work. Thank you so much. Hi, my name is Blair Overstreet, and I'm with the Center on Policy Initiatives and the Invest in San Diego Families. I'm actually just going to read off some questions that we'd like some more clarity on. Some have already been addressed, but just want to make sure that we get some clarity. So we know that in the near future, renovations of the Rock Mountain Detention Facility will be completed, and this project was a massive investment that we'd like to see diverted, but was much needed for individuals incarcerated in county facilities that were failing to provide even the most basic amenities. While renovations such as this one are important to ensure quality of life for incarcerated individuals, the county should move away from creating more detention facilities and must move towards decarceration. We must continue the important investments being made in community service and diversion programs. So I have a few questions. Is the sheriff committed to the goal of lowering the number of individuals incarcerated in county facilities? And we would like details of those goals, please. We understand that a plan is currently being developed that will outline several future jail-related capital improvement projects. Can you please share any updates on development of this plan, and how are you planning to ensure that the Board of Supervisors and the public are informed of this plan and opportunities to provide input, please? As your department is developing its budget now and in the next year, we'd like to ask, how are you going to account for the fact that crime rates are going down, prison populations are declining, and that our county is working towards a system where we are no longer incarcerating people? And then I also want to enter some questions about the phone calls. The budget adds $2.7 million to the sheriff's budget to backfill lost revenue to the inmate welfare fund. Can you explain why it is necessary for this money to come from the general fund? The sheriff's department has a budget of over $1 billion. Have you thoroughly explored opportunities to cut extraneous costs in other areas of the department? And lastly, in the May 4th, 2021 report for item 2, the public safety group shared that starting on July 1st, the sheriff is cutting down telephone calls from 30 minutes, no limits on number of calls, to one 15-minute call every 3 hours. We understand the need to ensure user rotation, but can you please explain the justification for cutting people's call time in half before even implementing the program? Thank you so much, and thank you for providing this departmental transparency.
Thank you, and that concludes public comment on the public safety recommended operational plan.
Thank you. Let me turn it to Holly or any team for any closing thoughts.
Thank you, Chair and members of the board. With a community that is focused on criminal justice system reform and racial justice, we see opportunities to listen, to learn, and where appropriate, to change. The county's public safety departments are actively engaged in that process. We recognize the way we've always done it is not a reason in and of itself to continue doing it. The Public Safety Group is committed to continuous improvement and to working with the community to ensure the safety, security, and protection of those we serve. We're working across all disciplines, including the Health and Human Services Agency, and with community-based providers to continue expanding partnerships and to improve outcomes. We look forward to the coming fiscal year with a sense of purpose and optimism. This concludes the budget presentation for the Public Safety Group, and we really appreciate the opportunity to present the information today and to answer your questions.
Thank you. Thank you, Holly, and thank you to all of our presenters in the Public Safety Group. We appreciate your time. We're going to transition now into our Health and Human Services. I would just mention for callers who want to speak on this item, we're going to begin the process doing Health and Human Services. Then at some point we will break for lunch and reconvene. So we've got a little bit until we get to the public comment on this item. But with that, let me kick it to Nick to do the introduction, and we will get through as much as we can until we break. Oh, hold on one sec. Vice Chair Vargas? Oh, I'm so sorry.
No, no worries. No, it's okay. We're still trying to figure out the whole technology thing. But I just wanted to have clarification. When do we ask the general budget questions? Do we wait until tomorrow or in between? I just had a question specifically to language access, and I'm not sure where in the budget process.
Yeah, let's see what section that's in.
That will be in FG3, which will be tomorrow.
Fantastic.
Tomorrow.
Thank you for that.
All right, thank you, Vice Chair. All right, Nick, take it away.
Oh, good morning, Chair Fletcher, members of the board. As agency director for the Health and Human Service Agency, I'm pleased to be here today with members of the agency's leadership team to present to you an overview of the significant achievements and budget recommendations for the Health and Human Service Agency as outlined in the County of San Diego CAO recommended operational plan. I'd like to quickly introduce some key leadership from our team. Up here on the dais, a familiar face to you already, down at the well, is Andy Pease, our Chief Operations Officer, and Amy Thompson, our Chief Finance Officer. Now, I'd like to put some faces to the names to you, starting with our presenters today in the well, starting with Dr. Kim Giardina, our Director for Child Welfare Services, Rick Wani, our Director for Eligibility Operations, Kim Gallo, our Director for Aging and Adult Services, David Estrella, our Director for Housing and Community Development Services, and Dr. Wilma Wooten, our Public Health Officer and Director for Public Health Services. Noticeably absent today is Dr. Luke Bergman, our Behavioral Health Services Director, who's out of town for a family emergency. Our thoughts are with him. We do expect him back soon. Next, I'd like to introduce our directors who are not necessarily speaking today, but who lead our service departments. Barbara Jimenez, our Community Operations Officer for our new Department of Equitable Communities and Homeless Solutions. Carrie Riccatelli, Director for our Office Strategy Innovation. Elizabeth Bustos, our Community Development Liaison. Dr. Eric McDonald, our Chief Medical Officer. Jennifer Bransford-Coons, our Director for Equitable Communities. LaShandra Gaines, our Director for Public Administrator, Public Guardian, Public Conservator. Omar Passons, our Director for Homeless Solutions. Will Quintong, our Military and Veterans Affairs Officer. And this is like a collegiate team. They come in and they're waving there. Our support team is the backbone also, and I just want to give them a shout out. Patty K. Dannon, our HC Departmental Operations Officer, Kim Evers, our Group Human Resources Director, Maggie Ramsberger, who's helping with our Community Action Partnership and also stepping up on HC contract, Richard McWilliams, our IT Director, Chuck Matthews, who's stepping in as the T3 vaccinations. But finally, we also have two other county leaders that are part of our family. Alethea Arguez, who is the Executive Director of the Fresh 5 Commission, and our new Executive Director for HHSA Public Authority, Thomas Johnson. Is Thomas here? There he is. Okay. With that out of the way, we have a great team, and I'm excited that we are part of this presentation to your board. Let me start by saying that the Health and Human Services is an integrated agency providing health, housing, and human services through a very robust, collaborative service network for all 3.3 million San Diego County residents. Our mission, it's to empower all people to live healthier, safer, and self-sufficient lives by delivering essential services in San Diego County. And Live Well San Diego is more than a vision. It's the way we work, ensuring that there's a region that is building better health, living safely, and thriving. The agency is one of 4 county groups that represents nearly 40% of the county's total budget, with its broad-reaching essential safety net services, including aging and dependent services, behavioral health, child and family strengthening services, affordable housing, and helping the homeless, our medical care services, our public health, self-sufficiency, and veteran services. The COVID-19 pandemic thrust upon us all in 2020 created essentially unique challenges for very large safety net providers such as our agency. I'm proud to say our team not only overcame, but found a way to persevere and innovate throughout, working closely through your board's leadership and our CAO and our many community partners and colleagues across the county. Over this past year, the agency led the county's COVID-19 pandemic response and did so while maintaining safety net services to the region's most vulnerable. Leveraging the infrastructure developed through the COVID-19 test, trace, and treat, as we call T3, we created a comprehensive vaccination program, one that proved so effective that we've always led the pack among Southern California counties in the per capita vaccination rates. Today, we're on track to far surpass President Biden's goal of vaccinating 70% of the eligible population by the 4th of July. In San Diego County, we're projected to reach that goal just in time for this Memorial Day weekend. This is through the hard work of our team and our community partners. Another innovation in our COVID-19 response was the creation of the Live Well San Diego sector model, which used weekly Zooms with many hundreds and hundreds of stakeholders, providing them important information on the rapidly evolving public health crisis. Addressing an unprecedented pandemic meant breaking down barriers to tap into all resources to support the effort. Our county secured state approvals that allowed trained paramedics and emergency medical technicians eligible to conduct COVID-19 testing and later vaccinations, greatly supplementing a medical workforce stressed through the height of the pandemic. This will helped accelerate the great work of Operation Collaboration in our city fire departments. At the same time, we've amplified our efforts to support San Diego's most vulnerable. Our staff coordinated the delivery of more than 4 million meals to seniors who initially found their lives scrambled by stay-at-home orders and who later were able to count on nutritious meal deliveries as the pandemic reached its peak late in the year. We knew that with the unpredictability of the pandemic and the social isolation, that mental health crisis would spike. This is why we pushed forward through the chair's leadership with the advancements in our behavioral health continuum of care model, with the addition of the crisis stabilization units, behavioral health hubs, mobile crisis response teams, and telehealth. While we had a major focus on disease investigation with COVID-19, we also did not lose sight of our other infectious diseases like Hep A and C, and tuberculosis and HIV. Without timely case investigations and contact tracing, these diseases would have posed a greater threat to the public health. During this time, the agency's eligibility team ensured more than 1 million, let me say that again, 1 million children, adults, and seniors were connected to federal and state benefits to help meet basic needs such as access to medical care for their health care, addressing food insecurity, and cash assistance for living expenses. With our family resource centers operating with minimal staff, we turned to technology-based solutions and increased response times to callers, leading to record levels of eligibility services. Now, this next slide offers a look at the agency by departmental budget and full-time equivalent positions. The agency's budget is proposed to increase more than $211 million for a recommended budget of $2.7 billion, our largest budget to date, with an increase of 311 positions. You'll hear today from the 6 service departments, which are child welfare, self-sufficiency, aging and dependence, housing, community development, public health, which includes, by the way, medical care services, and then behavioral health services, which I'll provide. Also on this table is the county successor agency established to wind down the affairs of the former County Redevelopment Agency. And while we will not have a separate presentation on the administrative support, the work under this department remains a critical part of our agency. Divisions within the administrative support, like Finance and Support Services Division, Human Resources, Information Technology, Office of Military and Veteran Affairs, and agency contract support all help ensure that the agency as a whole delivers services in a professional and cost-effective manner. Administrative support divisions also develop their own strategic goals. One example is the Office of Military and Veteran Affairs, which in 2020 decreased veteran service representative appointment wait times from 8 to 10 weeks to less than a week by emphasizing a virtual service delivery system. First Five San Diego, which is dedicated to upstream and preventive care, is another agency connected to as part of our administrative support. The First Five Commission, headed by Chair Fletcher and including Dr. Wooten as commissioners, meets regularly and ensures that First Five promotes, supports, and improves the early development of children from prenatal stage to age of 5. You'll notice a decrease, by the way, of the administrative support of $72 million in the red at the right. This is a result of moving much of the COVID-19 response budget out of admin support into public health services. The $211 million increase in the agency budget is driven by several major areas of investment. I'd like to cover those. As referenced earlier, the budget increase helps fund 311 additional staff years. These new positions are vital to addressing increasing caseloads for safety net programs, including cash and food assistance, as well as Medi-Cal, in-home support services, and adult protective services. We're also bolstering several priority areas with staffing, including behavioral health and public health services and child welfare services, which you'll hear about more from our service department directors. Efforts to address homelessness include 19 new positions to support the new Department of Equitable Communities and Homeless Solutions. Also new, the Office of Immigrants and Refugee Affairs will be added 2 positions, as well as 2 additional positions to focus on streamlining and leveraging existing county services and programs and benefits for working families as part of the new Department of Equitable Communities and Homeless Solutions. Half of our spending increase, nearly $105 million, will support our continued pandemic response efforts covering items such as testing, culturally competent disease investigation, and vaccination efforts. The good news is that we'll also have new service investments in all priority areas, which include behavioral health and public health service delivery, homelessness and affordable housing, strengthening children and families, supporting seniors, and meeting the growing need for safety net services. In total, we've been allocated $21.3 million in additional general purpose revenue to help meet those needs. Your board's initiated framework for future has set a new foundation for the agency and indeed the entire county. The framework is built upon the important tenets of racial equity, social and environmental justice, and sustainability. To ensure transparency and open government, we'll continue to engage and collaborate with community members through our advisory boards and community forums and make our public communications transparent and available online. We'll also conduct outreach to ensure the San Diegans have a clear understanding of our programs, including that of the safety net services. To diversify our contractor pool, we're promoting inclusive procurement and contracting administrating practices. We're also mindful of tailoring specific and cultural responsive services to best meet our very diverse communities throughout the county. Earlier this year, your board declared racism as a public health crisis, and indeed it is. We are steadfast in ensuring racial equity and institutional changes. Understanding that racism underpins health inequities throughout the San Diego region and has correlations to poor health outcomes, we are committed to addressing this issue head-on. One key agency initiative is conducting health equity and racial equity training for all of our Health and Human Services employees and our community partners. Through population health strategies like the applicable use of data, we will identify and address health disparities, as we've done with COVID-19. We have also intentional programming with the development of the Child and Family Strengthening Advisory Board's Race and Equity Subcommittee and others to address racism as a public health crisis. Regarding the comprehensive harm reduction approach, which will be heard by your board in a few weeks, both behavioral health services and public health services are moving ahead with a comprehensive strategy. As our current response efforts with COVID-19 remain a top priority for the agency and enterprise-wide, data collection is crucial to ensuring that regional vaccination and testing efforts continue to be prioritized for lower quartile areas as indicated by the Healthy Places Index. We continue to pursue innovative uses of resources such as a mobile public health lab to provide more accessibility for urgent testing in communities of need. Innovative services will remain active in the new budget year, including the Emergency Rental Assistance Program and telehealth services. Finally, public health services continue to be a crucial partner in efforts around the Climate Advisory Committee, conducting workshops on the local public health impacts of climate change. Chair Fletcher and members of the board, our Health and Human Services Agency can and will accomplish all of this while remaining focused on fiscal responsibility, and will do so by prioritizing resources for areas of need based on community input and strong data analysis. So I'd like to now turn it over to our first Service Department Director for Child Welfare Services, Dr. Kim Jardinia, who will discuss key areas of investments and goals achieved this past year. Kim?
Just real quick before we go to Kim, Nick, I just want to take a moment. I think COVID has been difficult for everyone society-wide, from small businesses to schools. Every aspect of county government has been tested. But I don't think any agency has been tested the way Health and Human Services has. And when you think about a global pandemic that has never happened in our lifetime, the incredible work that our public health teams had to do, which are embedded in a part of our Health and Human Service agencies, has been tremendous. It has been a literally 24/7 response that has required us to deal with challenges and complexity and difficulty, the likes of which we've never experienced before. And I think our Health and Human Service team has done an incredible job managing through that. And I think that is demonstrated in a lot of the statistics that Nick just shared. But not just our response to COVID. This agency has been tested and pushed in pretty much all facets of what it's been doing. While we were responding to a global pandemic, our Child and Family Strengthening Advisory Board was pushing our Child Welfare Department to continue to implement all of the changes that we need to see made, and we continue to make progress in that. While dealing with the global pandemic, we began the process of standing up a homeless service and equitable community department to increase our commitment and funding to tackling those issues. While dealing with COVID-19, our behavioral health services have been pushed to implement comprehensive harm reduction strategies, to manage multiple massive investments in staffing and facilities and personnel, to guide our way through a Medi-Cal re-procurement process. And I could go on and on throughout this, but I just want our Health and Human Services team to know that all of that work while dealing with the pandemic and not losing sight of everything else is recognized and is appreciated. And we have a lot of work to do moving forward. But everything from ensuring seniors got fed, to foster kids got checked on, to eligibility services remained available while we were dealing with all of that is a great testament to the strength of our agency and department, and is recognized and appreciated. And we're all looking forward to June 15th and beginning to shift some attention back to broader issues of public health. You know, we said the other day, Dr. Wooten's job is not just COVID. Dr. Wooten cares about a lot of public health things, and our commitment to all of those will remain and continue. So thank you to everyone. Vice Chair Vargas.
Yes, thank you, Chair. I just wanted to, in addition to your comments, I just wanted to say that, you know, on January 4th, you had a whole new vision from a new board about really looking at what equity looks like, particularly for our communities. And I just want to say thank you for stepping up and pivoting. There's been a lot of demands from some of us to all of you, but it's very appreciated, especially in regions that for decades had not had access to resources at the level that all of you have really, you know, figured out a way to make sure that we are doing the right thing. So from vaccines to access to food, it's just the beginning of the great things that we will do, but I did want to say thank you. Thank you for pivoting. Thank you for really understanding what equity means for our communities. And no one, I think, impacts our communities more than the Department of Health and Human Services, particularly as a safety net. That's what we are as a county. And so I really wanted to say thank you. I know you don't hear it enough, but thank you for pivoting in a really short amount of time. Muchas gracias.
And there will continue to be a lot of demands. Yes. We have seen what we could do in a pandemic, and now we've got some other pandemics to tackle, and we're looking ahead to the future with optimism. So thank you to you all. Kim.
Thank you, Chair and Vice Chair, and good morning, members of the Board of Supervisors. Thank you for the opportunity today to share some of the work that we've done this past year in Child Welfare Services and what we're looking forward to in the upcoming year. Child Welfare Services is committed to ensuring the safety of our children and strengthening our families so they may lead a life that is healthy, safe, and thriving. Our primary charge is to respond to allegations of child abuse and neglect and ensure that children are safe. However, over the past 10 years and continuing going forward, we have continued to make significant shifts to focus more upstream and expand our family strengthening and child abuse prevention efforts, reducing the number of children in foster care by 42%. Last year has been a challenging year for all of us. We've not only been busy responding to the pandemic, but had to change how we do our work dramatically. Child Welfare Services continued to do in-person visits with children and families to ensure that they were safe, protected, and getting the services they needed to make themselves more resilient. Some of the year's accomplishments are highlighted on the slide. As of May 17th, 2021, we have conducted 17,429 investigations of child abuse and neglect, which represents over 32,000 children in our community. And we are currently serving over 2,000 youth in foster care. Over the past 2 years, Child Welfare Services has undergone significant system reform with guidance from the Child and Family Strengthening Advisory Board. We have now completed 71 out of the 88 Child Welfare Services Working Group recommendations. One of the recommendations we completed included the development and implementation of advanced training units for all newly hired social workers, ensuring they have an onboarding experience that improves staff retention and quality of practice. These new training units were recently awarded a NACO Achievement Award. For additional quality assurance, we also added chief of practice positions that have helped to improve the consistency of our practice amongst all of our staff. As we focus on diversity, equity, and inclusion, we have decreased the number of African American children and youth in open cases by 62% and Native American children and youth by 52% over the past 10 years. But we still have a disproportionate representation of these populations in child welfare services. We have engaged with the Child and Family Strengthening Advisory Board to advance our Equity, Diversity, and Inclusion Action Plan, which includes enhancing social worker training for both new and current staff, enhancing skills at the leadership level to ensure that culture and equity is woven throughout our agency, and developing hiring, recruitment, and retention strategies to ensure the diversity of our workforce is representative of the community we serve. In responding to the pandemic, we increased the number of completed calls to the child abuse hotline up to 90% as a result of having a web-based call system with 100% of our staff teleworking. We also completed the first ever virtual adoption finalizations and project a 14% increase in adoptions compared to last fiscal year. We are looking forward to this upcoming year, continuing to make improvements to our child welfare system. Improvements will be made to our workforce development and support. We created a position to better engage with community members and decrease disproportionality, and this position will oversee all of our equity, diversity, and inclusion efforts within child welfare services. In order to support our staff and better address the effects of secondary traumatic stress, we began a pilot program of a supervisory curriculum to ensure that staff receive quality supervision focused on building resiliency within our organization. And we will now be expanding this pilot to all staff. In regards to our efforts toward family strengthening, the Board of Supervisors approved the Family Strengthening and Prevention Initiative in early 2020. The Family Strengthening and Prevention Initiative includes a partnership with 211 San Diego to provide a linkage to prevention services for families, as well as improving our screening of reports received by the Child Abuse Hotline. So far, we have seen some wonderful examples of how connecting families with resources they needed, such as housing, food, support groups, and mental health services, have prevented children from entering foster care. We look forward to expanding the Family Strengthening and Prevention Initiative to other areas of the county so we can support families who are at risk and increase their protective capacities. For our children and youth in foster care, we want to make sure their well-being is our top priority. We're increasing staff to support placement integration efforts outlined in the working group recommendations and hired a fellow to focus specifically on increasing children placed with relatives. We are excited to expand the Fostering Academic Success in Education pilot. This program focuses on ensuring middle and high school age foster youth in Sweetwater Union School District improve their educational outcomes. During this pandemic year of the pilot program, 70% of students improved their GPA, and all seniors are graduating with a 3.8 GPA or above. We look forward to expanding this program to support more youth in foster care with academic success in their community schools. Under an extension of the MOU with the California Department of Social Services, San Pasqual Academy will be allowed to operate through June 2022. This will enable youth who are seniors and juniors to graduate from San Pasqual Academy without having to make placement changes. We are working closely with youth, their families, and others in their lives to find the best alternate placement option. We are also working with various stakeholders, including the Child and Family Strengthening Advisory Board Foster Youth Subcommittee, which includes alumni and former foster youth, to determine the future of San Pasqual Academy that would allow it to continue to serve our youth in ways that are in alignment with state and federal regulations. This slide shows our progress in achieving our operational plan measures for this year. And we are actually anticipating we will exceed performance in regard to the number of resource families ready and available to receive placement of foster children, and in the number of calls completed by our child abuse hotline. Overall, our Child Welfare Services budget is proposed to increase by $15.4 million for a total of $415.8 million. We have an $8 million increase in assistance payments, which is where grants to our caregivers for our foster and adopted youth are budgeted. This increase is driven by annual grant increases as set by the state, and also reflects increased support for our youth in extended foster care during the pandemic. We are also proposing 38 new positions for a total of 1,530, as well as adding and enhancing resources to strengthen families and ensure children grow up safe and nurtured, and I'll explain these on the next slide. Significant budget adjustments include the addition of 38 positions, with a GPR increase of $3.8 million to support new programs, like the Fostering Academic Success and Education expansion, our placement integration efforts, and after-hours response. The Family Urgent Response System is a new support for children in foster care, former foster youth, and their caregivers, which provides a 24/7 mobile crisis response to promote placement stability for youth. We are also creating an online portal that mandated reporters will be able to use to report allegations of child abuse and neglect, saving time that reporters have to spend on the phone and increasing the accuracy and efficiency of reports we received, which will allow us to better serve children and families. Child Welfare Services has been working on many areas of the framework for our future. All of our policies and data have been made publicly available on our website. Our Child and Family Strengthening Advisory Board meetings are open to the public and have strong community participation. We are expanding our efforts to recruit resource families to make sure that we reach all San Diego communities, specifically through the utilization of culturally matched media and social media outlets. We have procured the Family Support Liaison Program to provide prevention services to African American and immigrant and refugee families throughout the county. We established the Child and Family Strengthening Advisory Board Race and Equity Ad Hoc Committee to focus on disproportionality in child welfare and to address racial and social inequities for the children and families we serve. We are helping foster youth to receive their COVID-19 vaccine when eligible to support the county's vaccination efforts. The Family First Prevention Services Act will take place October 2021. Child Welfare Services is developing a strategic plan in conjunction with juvenile probation and behavioral health services and our community partners to enhance and expand child abuse prevention efforts throughout San Diego. We are also continuing advocacy at the state level to ensure the state plan aligns with San Diego priorities for family strengthening and child abuse prevention. Child Welfare Services is also sustaining a remote workforce, with staff being able to access the office as they need, reducing their time on the road and their carbon footprint. We already reduced our facility footprint this year by closing one office and are evaluating other facilities that can be reduced. Thank you for the opportunity to share this information about Child Welfare Services. This completes the presentation, subject to any questions from the board.
Thank you, Kim. Let's go first to Vice Chair Vargas.
Thank you, Kim, for all of that information. I have just a couple of questions. One was related to the 15 staff years for the placement of integration program. What is the total number of positions that are budgeted to assist the youth with placement options?
The total number of positions that is budgeted for placement is 36.
36, okay. And then I saw that there's 6 staff years to create an emergency after-hours response hotline screener unit. Is this call center going to be connected to 211, or is there going to be a whole separate number? And then also, are the intended calls only receive calls to report concern of child abuse and neglect? Or is it something that we can also include appropriate place for, like, when teens call? One of the biggest challenges I heard, particularly as a member of the South Bay LGBTQ Center, was that a lot of our kids, found themselves in difficult situations in the middle of the night, and they really didn't have a number to call. And so I think Barbara and some of the other folks were really good at finding resources, but if there's a number that maybe youth can call into, and I don't know if there's a specific program, and maybe can that be something that could be integrated into that? Because especially for our transgender youth in South County, it's a huge issue about where do they go, and sometimes, it happens in the middle of the night and they have nowhere to go. So I was wondering if it's bigger than that, or is this just specifically for receiving information about abuse and neglect?
Yeah, thank you, Supervisor. So right now, when we get calls regarding child abuse and neglect after hours, we have what's called a standby system. So staff have worked all day. They volunteer to work overtime at night and respond to those calls. So really, this unit is to make an actual shift for after hours so that our staff don't have to work during the day, overtime, and then come back to work the next day. But I do think there are opportunities that we can explore, especially through the partnership we have with 211 San Diego around those prevention services, to think about how we might support teen youth.
Okay, appreciate that. Thank you. Sure.
Kim, quick question. I know we're 71 of the 88 recommendations are done. Is there adequate services provided in this budget to help us accommodate all 88 recommendations being implemented, or do you anticipate some we wouldn't do? I mean, I guess I'm asking, are we set up to, before the end of the year, be able to implement all 88 of those recommendations?
Chair, yes, we are. Several of the components of this budget will help us complete the remainder, and we will be finished with those recommendations by the end of this year.
Okay. And as we prepare, obviously, we don't quite know what the future of San Pasqual looks like. We know it will be something legally compliant with state and feds and serving youth in general. Do you think you have adequate resources to do the planning, the preparation? Obviously, we can continue until June of next year, so we have a little bit of time. But June of next year gets us into, I mean, do you feel confident you have what you need to help us explore and plan out and begin the implementation of what we do on San Pasqual?
I do, Chair, and we're already exploring some options. We likely will begin those stakeholder groups next month because we know we want to move on this quickly.
Okay. Next question. I know in previous years we spent a lot of time talking about the overall health of our workforce, investing in the health of our social workers, what a difficult job that is, and just wanted to check in on how you feel about the ability to invest and maintain the spirit, morale, productivity, retention of our workforce, and if you feel good with what the resources you have in order to be able to achieve that.
Chair, thank you. Yes, and some of our previous investments have included the workforce training and development units that I mentioned, which are showing a high rate of retention for new staff. We have added 3 additional staff psychologists to our team, which really help provide that debrief support to our staff, that mental health consultation to them. Of course, the pandemic was tough, right? Our workers were still going out in the field during COVID, but I think we've made some great investments to support our staff.
Great, thank you. All right, not seeing any questions from any of my colleagues. Thank you, Kim. We will, Nick, you want to introduce your next group?
Thank you, Chair. Rick Wani is Director of Eligibility Operations, and he'll give an update on eligibility services. Self-sufficient.
Chair Fletcher, Vice Chair Vargas, and members of the board, I will now take you through the self-sufficiency services overview. What do we do in self-sufficiency? Self-sufficiency services provides eligibility determination and access to state, federal, and local public assistance programs for over 1 million San Diegans, ensuring accurate and accessible benefits to those eligible. Our mission is to help people attain self-sufficiency by delivering essential services in San Diego County, and our vision is to align the efforts of individuals, organizations, governments to help all 3.3 million San Diegans build better health, live safely, and thrive through the provision of accurate and accessible benefits. Next is our services highlights and accomplishments during this last year. We successfully delivered critical self-sufficiency public assistance benefits to over 1 million San Diegans. We processed 95% of our CalWorks, Medi-Cal, and CalFresh applications timely. we successfully enrolled over 200,000 net new residents in self-sufficiency programs during the COVID-19 financial emergency, which is a 20% increase from prior to COVID. We preserved state-required program delivery accuracy rate of 95%. We increased to over 60,000 the number of seniors receiving CalFresh benefits. We increased to over 35,000 the number of eligibility status reports and renewals that were submitted electronically, so our customers do not have to come to our offices to drop off documents. And we maintain full and open operations at all of our 13 family resource centers during the COVID-19 health and economic crisis, servicing approximately 25,000 customers a month at the front of our lobbies throughout the county. We issued $982 million in cash and food assistance benefits to our recipients, and we supported our most vulnerable in San Diego's local economy. And we successfully deployed the Live Well mobile office for COVID-19 response and benefit access, serving over 5,000 residents during the last year, and have successfully transitioned over 1,100 employees to permanent telework status. In looking forward to the next fiscal year, 21-22, our goals continue to include to process up to 96% of our CalWorks, Medi-Cal, and CalFresh applications timely, to provide an additional 47,000 seniors with CalFresh benefits, to ensure 25,000 additional eligibility status reports and renewals are submitted electronically, and to work closely with our Social Services Advisory Board to increase access and enrollment in county self-sufficiency programs to serve every community member in need without barriers to access, and increasing outreach and enrollment efforts to hard-to-serve community members by adding an additional mobile office. This slide displays the self-sufficiency key performance measures for 21-23 as outlined in the proposed operational plan and as referenced in my earlier comments. Regarding self-sufficiency's expenditure summary in the 2021-22 budget, recommended budget, it's over $613 million. Our budget is proposed to go up by over $62 million, and with the support from your board, an increase of 100 positions, bringing the total to 2,629 positions in self-sufficiency. Self-sufficiency services has the highest number of budgeted staff in HHSA, driven by human services specialists responsible for enrolling residents in essential safety net services. Of the 100 new positions being requested, 90 are human service specialists and human service specialist supervisors, which are being added to address the significant increased workload requirement demand in Medi-Cal and CalFresh described earlier. Like child welfare services, we also have assistance payments components of the budget where cash grants and direct support to our CalWorks and general relief recipients are budgeted. The increase here is largely driven by an increase in supports for CalWorks recipients and align with additional dedicated CalWorks funding allocated by the state. I'll review more of these increases on the next slide. This slide presents self-sufficiency's significant proposed budget adjustments for the coming fiscal year. The largest component of our $62 million increase is in salary and benefits for the additional 100 positions, as well as salary adjustments and retirement increases. Fortunately, we have seen significant increases in federal and state funding to help offset additional costs of administering our programs. Given this, we're able to fund almost $23 million in additional services for CalWorks housing support, home visiting services, and to support positive health development and well-being outcomes for new parents, and a range of employment services and supports for our eligible CalWorks families. We do have one program, General Relief, that is entirely county funded. You'll see an increase here of $3.3 million for anticipated caseload growth needs, funded with one-time county fund balance as we wait to see how the longer-term General Relief caseload trend unfolds. We also have budget adjustments to continue the COVID-19 Positive Recovery Stipend Program into the new year as needed, and various adjustments for increased 211 services and ongoing support for our new call center technology. that has helped contribute to our increased efficiency and excellent outcomes in serving residents under our telework model. In looking at the future, for county resources, we are requesting an increase of 100 staff to deliver essential safety net services effectively and efficiently, and to continue to remove barriers to access for critical safety net programs. For a COVID-19 equitable data-driven response, we plan to provide one-time stipend payments in the amount of $1,000 through the Board of Supervisors COVID-19 Positive Recovery Stipend Program to San Diego residents who have tested positive for COVID-19 but are not eligible for paid time off through their employer. And for our legislative agenda, we plan to advocate for federal and state regulatory changes that increase resources and outreach and overcome access and program retention barriers. In aligning our framework for the future, in addressing racism as a public health crisis, we will continue to ensure that all self-sufficiency programs are equitably accessible to all vulnerable residents, and we will enhance culturally competent and linguistically appropriate equitable service delivery practices. In addressing transparency and open government, we will continue to strengthen partnerships with our community, our Social Services Advisory Board, and stakeholders on outreach, access and enrollment, and retention in safety net programs. That concludes the presentation on self-sufficiency, subject to your questions.
Thank you, Rick. Let me ask my colleagues if they have any questions or comments on this. Vice Chair Vargas.
Thank you, Chair Fletcher. A quick question: of the 100 staff, have you thought about having a promotora model as part of that process? I know that a lot of the work that we do, particularly in outreach, is directly connected to organizations who do a really good job, but I think as we're moving forward, having a system like that within the county, this whole idea of making government work for people, and so that our communities understand that they can have access without a third party. A lot of people don't know that it is the county that's actually providing the services, right? That's what happens, and so I'm interested in ensuring that people know that the county is theirs, that they can come, that this is a place where people can apply for services. We are the safety nets, and so I'm wondering if those types of models are actually being thought about as we're thinking about the 100 folks who are going to be part of this.
Vice Chair Vargas, so currently the way the proposed op plan is presented, we are requesting 100 eligibility staff, human service specialists, and their supervisors. And this is due to the increased workload to the 200,000 plus new recipients on our programs. And so these services need to be provided by those type of positions and classifications. In terms of outreach and application assistance and the promotora model, we do partner with a number of community organizations and partners on assisting us with the outreach process, the application process, and submitting applications and so forth. So we do partner with them.
So I think I'm really interested in creating a model that is county-based. I think there's a lot of opportunities for us to really engage from a very different perspective. So I'm hoping that that would be something that we can think about.
Vice Chair, if I may,
yes,
just to add that beyond self-sufficiency, what we saw for disease investigation and public health and what promotors did, to your point, I think the applicability has it across many of our programs. Yeah. And so that is something we're very interested in doing and developing and continuing, even with public health.
Yeah, thank you very much. And then I think I just want to make sure there's clarification. The ARPA funding is one-time funding, right? And so how is that? I feel like sometimes in these budgets we have a large number that we're not specifically saying this amount of money is only one-time funding, and the rest is to be able to ensure that it's overall programming for everything else. And so I want to just make sure that we're very clear on the record of what that is.
Thank you, Vice Chair. Yes, absolutely. That is really important. And so as we go through anything that's in the budget, unless it's clearly a capital item or a specific grant, you can assume that it is ongoing. Of course, it would be subject to approval every single year. When we go through the change letter, however, we will be identifying, and the same with ARPA, things that may be using one-time money this year to bridge until next year's general purpose revenue allocation increase, and then that would come off the top. So Ebony will be doing a very thorough presentation on that as part of our change letter. Ebony, do you want to add anything else?
Yes, just to answer your specific question in regards to ARPA funding, we do have $88 million included in the operational plan for the Health and Human Services Agency, specific to our response efforts and our T3 efforts. So those are obviously one-time activities. They will wind down, but they are included based on a program revenue.
Okay. And then in this particular budget, I think one last question is, do we have a percentage of the increase? I know that we introduced a board letter specifically to address access to Medi-Cal, CalFresh, some of the local services, how many people are actually using it. I know we're in the process of looking at who our, our managed care partners are going to be and how that's going to work. And so you don't have to give me the number now, but I think it would be important to know what are we looking for in terms of the conversation for many years has been, well, people are not enrolling on these programs. And what we saw through the pandemic is that if we make it accessible and easier and people know that they are actually using the programs that are available to them. And so I would like to be able to really look at what those numbers are as we're moving forward. So not more a question, but a request. And then last but not least, I just need clarification because I know that we introduced the P100, item back in one of the board letters to ensure that we're not really focusing on, we're trying to really divert from that particular issue about fraud, but there is an increase of $1 million for fraud investigation services, particularly in this program. So I'm trying to figure out how do we balance that and what does that mean as it relates to the other board letter that we had?
Sure. So Vice Chair Vargas, the ways the funding works in terms of Health and Human Services and the CalWorks program, we provide administrative funding to child support services for the state-required mandated fraud investigations, not P100. They're in the process and have implemented a new data system, so it's for an IT system that we share with child support services for their fraud investigation. It's not for additional investigators or staffing.
Okay, perfect. Thank you very much. Thank you for your responses.
Yeah, thank you. Thank you, Vice Chair. Thank you, Rick. I think what we'll do, let's go ahead and power through here, and let's do Kim's presentation. We'll do Aging and Independent Services. We'll have 3 of our Health and Human Service sections done, and then we'll break, and then we'll come back and do the final 3. So Kim, go ahead and take it away.
Good afternoon. Thank you. I'm Kim Gallo. I'm the Director of Aging and Adult Services at Aging and Independent Services. Aging and Independent Services, or AIS, is part of the County of San Diego Health and Human Services Agency. AIS provides assistance, information, referrals, and support to over 65,000 older adults and residents living with disabilities each year. Our mission is to make people's lives healthier, safer, and self-sufficient through services that help keep them in their own homes at low or no cost. We are dedicated to opening the door of opportunity for seniors and persons living with disabilities. AIS provides a wide array of services that carry out the goals and objectives established in our county's local aging roadmap. This year, we served more than 4 million meals through our nutrition program, and that does not include another 4 million meals that we provided through the Great Plates Delivered program. We reached a variety of vulnerable populations through outreach and services to support food security among our senior nutrition clients and others in the community. Our IHSS program exceeds the state performance expectations for timely eligibility assessments for IHSS, with 96% completed within 45 days, as well as for annual reassessments, 98% were on time. APS staff conducted 97% of face-to-face contacts within 10 days of receiving an APS referral to ensure timely assistance and resources. In addition, the public conservator staff conducted 98% of investigations for temporary conservatorship within 10 business days. We're extremely proud of our staff's commitment to timeliness and excellence in serving the public. As we look to the future, we are pleased to highlight that our department's goals are closely aligned with California's Master Plan for Aging. The Master Plan has 5 bold goals, which you will see on the slide above. The state goals are in bold, followed by key AIS programs that support these goals. So the first goal, housing for all ages and stages, is captured by the work of our Age Well housing team, which works towards promoting affordable housing. The team also collaborates with Luge to address zoning issues in order to facilitate mixed-use development that meets the needs of seniors. For the Health Reimagine goal, our health promotion efforts, including the Feeling Fit Club and chronic disease self-management program, as well as our Alzheimer's effort, are just one example. In addition, our programs such as IHSS and case management support seniors to be able to live and stay in their own homes. Inclusion and equity, not isolation, is a goal that is very much aligned with many of our efforts. For instance, AgeWell teams are currently reviewing their goals to increase equity across all 5 teams: housing, transportation, health and community support, social participation, and dementia-friendly. In addition, AIS supports volunteering, technology education, and intergenerational programming. APS also helps to ensure older adults are protected from abuse and connected to services. The Caregiving That Works goal is captured by the AIS Family Caregiver Support Program, an Older Americans Act program, which provides counseling, education, and respite services to support family caregivers. Finally, affordable aging is a goal that is encompassed by our efforts to support older adults to meet basic needs, such as through our senior nutrition program. Some of the key performance measures that cover IHSS, the Senior Nutrition Program, Feeling Fit Club, APS, the Long-Term Care Ombudsman Program, and our call center are listed on this slide. We consistently meet or exceed state performance expectations for programs such as IHSS, and we show a high level of performance across all of our programs and goal areas. Our total budget for 21-22 is $248.2 million and includes 449 full-time employees. Compared with fiscal year 2021, 43 positions and $55.9 million have been added to the 21-22 budget. The increase ensures AIS will be able to meet continued growth in referrals and caseloads in the APS and IHSS program to increase safety for vulnerable elders and dependent adults. In addition, the funding will help decrease the risk of hospitalizations and out-of-home placements. The IHSS budget also includes $35.8 million to support public authority operation activities. The public authority provides services to the IHSS program. By state mandate, they are a separate legal entity from the county, but they work as a partner with IHSS, serving IHSS providers and consumers. Our 21-22 budget increase focuses on continuing to support COVID-19 response efforts to deliver meals to older at-risk adults, addressing the continued growth in caseload in IHSS and APS by adding additional staff years. And I will have to say my team and I are so grateful for these additional positions. We have had a lot of caseload growth over the last few years, so this is some excitement for them to know that help is on the way. We're also continuing to meet the county IHSS maintenance of effort requests and IHSS provider benefit increase. Supporting IHSS outreach efforts to both educate the community about the availability of services and to recruit new IHSS caregivers in the area of the county where they are needed most. We will also continue to support Alzheimer's awareness and support services and other valuable AIS programs. AIS programs, services, and practices align closely with the framework for our future. In terms of transparency and open government, we regularly provide forums and opportunities for the public to participate in community discussion to assess needs and concerns, plan for the future, and develop strategies to provide solutions to concerns. We annually revisit and adjust our strategic plan to ensure that the priorities reflect the changing environment, economy, and community needs. Every 4 years, we conduct a needs assessment as part of the 4-year area plan, which includes public feedback forums to obtain input from older adults and persons with disabilities on our services and plan for new services. In addition, our advisory council advises and assists in the preparation, development, and evaluation of county programs, procedures, budgets, and policies in accordance with the duties and responsibilities defined in the Older Americans Act. For bold climate action, our Age Well San Diego transportation team is working on goals pertaining to smart growth and active transportation, including emphasis on safe accommodations of bicyclists, pedestrians, transit riders, and drivers, as well as the implementation of a comprehensive regional transit policy. Serving a diverse population has always been an AIS priority, and we welcome the opportunity to continue to examine and reimagine our practices to combat racism and to promote equity. Our current commitment includes maximizing the number of staff who are evaluated for bilingual proficiency to ensure inclusive and responsive service and a no wrong door approach, ensuring diversity in all of our interview panels, participating in the California Health and Human Services Agency Language Access Work Group at the state level, which allows AIS to implement suggested and requested changes as soon as possible. We continue to ensure that our AIS advisory councils, race and ethnic composition is representative of the populations they serve. Enlisting our Age Well community teams to review their goals to increase the focus on equity. We have also been able to demonstrate a COVID-19 equitable data-driven response through our Great Plate Delivered programs, which helps at-risk older adults during the COVID-19 pandemic by delivering meals to their home. The older adult and disability sector releases weekly informational emails on COVID, and we host telebriefings once a month, as well as efforts to ensure older adults and persons with disabilities receive their vaccination, including those who are housebound. In addition, AIS staff continues to serve as the Care and Shelter Branch's County Shelter Team Unit Leader in the Emergency Operations Center during a disaster. In that capacity, AIS staff ensures specialized services are provided as required for the care of special needs population in the American Red Cross and county shelters. Finally, we are committed to effectively managing county resources and ensuring that our contracting practices meet the need of diverse population. At AIS, we have over 40 funding sources, which we effectively coordinate, and over 60 contracts that provide direct services for in-home support, respite cares, meals, both congregate dining sites and home delivered, health promotion, legal assistance, adult daycare, transportation, educational opportunities, employment, money management, and counseling programs. We use data to target and tailor approaches to meet the specific needs of the diverse individual populations within the community. We also work closely and collaborate with agency contract support and the Department of Purchasing and Contracting for the best approach on procurement and contracting strategies to reach contractors that will best meet the diverse needs of the communities our programs serve. Our proposed budget supports the programs and services that allow older adults and residents living with disabilities to live healthy and safe lives with maximum independence. Our goals are closely aligned with the state's master plan on aging and recognize the imperative to working towards equity and inclusion. Thank you so much for your support of these critical programs for our region's older adults and residents living with disabilities. This concludes our presentation, subject to any questions that you may have.
Thank you, Kim, for that, and I appreciate our commitment, our ongoing commitment to the Alzheimer's efforts. I made a commitment to Supervisor Jacob that we would see that through and we would not lose sight of that program and that effort, and I appreciate that going. I also think in general, I think it's good to see the increases to help alleviate some of what you're doing. I think we have to be mindful as a board that when we look at demographics and we look at what's coming, whether we call it the gray wave or the silver tsunami or whatever we call it, that this is going to be an area that we're going to have to continue to invest in and really analyze and prepare for what is coming. And I think we've seen, in particular with COVID being an illness that hit our senior population much greater, and that health challenges they faced, the food insecurity challenges they faced, the access to one another. We spent a lot of time talking about the impacts of COVID on our kids as they come back to school, and I think there's probably a little bit more focus and attention we need to pay as we come out of COVID about the impact our seniors faced in isolation. And the overall impact of them, but very pleased to see this moving forward. May I ask Vice Chair Vargas?
Of course I have.
I saw your microphone.
I know, sorry. Only question I have is about the $400,000 to support the IHSS outreach. Just wanted to know a little bit more about what that outreach strategy looks like.
Yeah, and that is as a result of the board letter a couple months ago that was put forward to increase the registry. So through our public authority, we want to have more backup emergency providers. I know in my conversation with you, Vice Chair, also sometimes finding a caregiver if they don't have an identified family member that is going to be the one providing the care can take a little bit of time. And so that may delay their ability to go back to their home, whether they're in skilled nursing or at a hospital. So some of that will be used to do outreach for the areas that we know they have a hard time finding caregivers in. And then we are also doing a profile where we're going to do kind of a day in the life of a caregiver, because one of the things I'm sure you guys know from looking at the demographics, older adults are the fastest growing segment of our population, not only in San Diego, but across our state. And it's a huge increase. So I feel like over the next few years, we're going to have such a demand for caregivers of all different types. And so whether it's IHSS caregiver for some of our respite programs, so we will continue to highlight what it's like and the importance. These are important jobs, and a lot of times people don't get the respect that they deserve. So we will be working closely at AIS with the public authority. We kind of work together on these issues to ensure that we are able to meet the outcomes that you guys asked for in your board letter.
I really appreciate that. This is an issue near and dear to my heart, as you know, and
Yes.
As many of us, particularly, I think the numbers, if I remember from the numbers of seniors who are living with particularly Latina daughters in our communities are higher than anywhere else, according to AARP. And so these service providers are angels to all of us who are trying to manage, those services. And so the more we can do outreach so that we can have folks who understand our communities and our culture and inclusivity, I think is such an important piece of this work. So I'm happy to support it. I just want to make sure that I got a little more information on it. So thank you.
Yeah, you offered to do a PSA for us, so we'll take you up on that.
I did.
So,
I have to say
thank you.
they've done an exceptional job with my dad. I mean, they have, it's just amazing. So I appreciate it.
It's a hard job.
Very hard.
Wonderful, thank you. We are basically at 12:45. We're going to take a 1-hour break, and we will reconvene at 1:45 and pick up with housing and community development services, and then carry through our remaining groups. Thank you all.